All right, we are live. I'm here with Ethan. Ethan, thank you for joining me today. We are going to discuss your experience thus far with skeletal expansion of both the upper and lower, which is unique. Not many people have gone through that experience of having, in addition to the upper jaw skeletally split, the lower jaw as well. Famously, only one provider in the U.S. really does that. That's Dr. Yousefian. I believe you've had the chance to be his patient. And so is anything I said untrue? You did, in fact, have upper and lower jaw expansion. Can you confirm? Can you give us the details and a timeline of your treatment?
Sure. Yeah, so I started the surgery
Ethan, your audio, your mic input is not working. So go ahead and get your mic tested up. Try the settings button below. You should be able to change your mic input. In the meantime, what I will do while you get your technical stuff squared away, I'm going to show the audience some pictures that you have shared. Well, what's this bullshit? Oh my God! Got a Google Chrome not allowing me to share.
All right,
I'll be right back.
Ron. I don't know if you can hear me. Can you hear me? Hello. I don't know if anyone can hear me. Let's see.
All right, and I'm back, and I hope that wasn't too disruptive. Ethan, give me an audio test. No audio? Just use your laptop audio if you have to.
Can you hear me?
Now I can hear you, yep.
I cannot hear you, but you can hear me.
Can the audience hear me? Audience, if you can hear me, let me know. Give me a thumbs up.
I don't know why we're having this issue now. We just figured it out. Let's see.
Can someone comment whether or not they can hear me? Whether they can hear Ethan? Who can you hear?
Okay. Can you hear me, Ron?
I can hear you, yeah. Can you hear me?
I can hear you now. We're all good. Thank God. Sorry about that. I don't know why that happened. Yeah, so my experience. I got MSE and MSDO done with Dr. Yousefian in Seattle. And I also have 2 bollards installed, which are secured by, I think, 3 screws each. And they're in sort of the zygomatic bones in here. So my face is kind of puffy still, but yeah, so they made a surgical cut in the middle and the mid-palatal suture on the top as well, which and I've also been pulling from the bollards and the MSE screws for on face mask, and been doing that for about a month. Yeah, what sort of questions and direction do you want to go with this, Ron?
I just want to make sure that everyone understands the technical details of what has been put and done into your face before we start talking results. So
sure.
Do you have a visual presentation that you can show that has images of the expanders? And then, so we have an upper, go ahead.
Yep, I haven't been able to get the CBCTs from Yousefian yet, but I do have pictures of the CBCT, and so I will pull those up.
Okay.
And I think I did post them a while ago on Discord, but they're probably a far back.
So post them here for the audience. We have, looks like we have more and more people joining.
Yep. Great.
Every moment.
Yeah, I'll put them in the main general Discord just so people, if they want to see them in full resolution.
Okay.
Because I have uploaded these before, but they're so far back. So are you able to access the Invisalign tray photos from recently in that chat as well? There's 2.
I am. Do you want me to do the screen share? I can screen share some of the images that I have.
Sure. Let's start with that while I load some more.
Okay. So let's see here. So here we have Ethan's MSE plus MSDO plus face mask. This is May 2024 at the top. You can see it looks like there's been some advancement that's occurred in the before and after. Yeah.
Yeah, definitely. As I mentioned in there, I've only been doing face masks for about a month, and I've been doing much heavier weight. That's a great image. That's the one I was looking for. But
What are we
looking
looking at in this
Yeah,
image?
so on the lower right hand image, you can see the cut that was made in between the teeth. There was a period of about 6 months where I was moving those low teeth apart, so I wouldn't damage when they cut it. And then they split it, and then there's a distractor which you can see in the front of the bottom left image near the chin area that is connected to the teeth, which are all bonded together. And that was what was widening that mandible gap. And I was chewing so hard at night during my sleep that I was actually closing the bottom expander because of how the bite works with how my upper was already wider than my lower. So it was already tipping my lower teeth in. So when I was trying to widen it with the expander, it kept it wouldn't expand at all. And so I had to, after 2 weeks, I had to really crank on it, and it finally opened. And then you can kind of see in the,
so Ethan, are you saying that
yeah.
you clench so hard at night that is it as a result of your airway deficiency? Like, have you always been a clencher?
I don't know why, but yeah, I've definitely been a clencher for a while. Yep.
Okay, and is that part of
I don't know why, but
is that part of why you sought treatment? Is because of your chronic nighttime clenching, or
I
not
think the
really?
clenching has been more of a side effect because I don't think clenching is necessarily bad if you have a optimized bite. But I had such a dysfunctional bite that it was putting so much pressure on the other teeth that it is not a good situation for my jaw, and that it was really the side effects of. I mean, the main thing was the sleep apnea. The TMJ, I could have dealt with the pain; it wasn't the worst, but it was uncomfortable. I mean, TMJ pain is uncomfortable.
Mm-hmm.
So,
And what else jumps out at you
apnea was
about
my
this?
main concern.
Yeah,
Sorry?
go ahead. You get back to this image and tell us why you think this image tells a big part of your story.
Sure. Does that explain enough of the treatment itself and what I went through and the timeline?
Feel free to elaborate more.
Okay, I think that's pretty decent. If you have any more questions, let me know. But this image was taken 2 days after I started face mask, so there's no real advancement effect. I did a face mask a few times earlier, but it didn't really feel that great. So I just on my TMJ, and so I just didn't do it that much until I felt better. And so I had the results from facing whatsoever because I have experienced, I would say 60 to 70% of the breathing increase has been through the face mask. It was better before when the MSE widened the base of my airway a bit, but it's night and day with the face mask in my experience. With just MSE, I don't know that I would get the same result. And it really feels, so I had several facial injuries. I had one here where this, zygo or orbital thing got broken. I had a big black eye, and then I broke my nose this way, right? So both of these kind of were pressing into each other, and there was a lot of tension that was, if you can pull up the before photos, I don't know if they're there, but I can send them. But the here, let me pull up the photo. It's easier to before. I'll put that in the main chat.
Here's a decent before.
Okay, yeah, and then I also just sent a side profile.
Where,
before.
where did you send that, on Discord?
The main Discord general chat, and yeah. And so if you look in the before, there's a clear cant that I already had to begin with, but the teeth were still sort of trying to keep themselves together. But as soon as I broke that mid palatal suture, all the tension released, and then this side dropped down or continued. You know, you can see how much lower it is. So I have a fake tooth in the center there, just so it doesn't look as ridiculous. But if you pull up that before, it's very clear that the cant is pre-existing. And so when I had that injury, it was putting a ton of pressure on my left eye. My left eye, the vision was getting worse in it. And once that left side opened up, which is almost about 90% of the expansion was on my left side, it relieved a lot of tension on that left eye. And so when I had those injuries, it was very clear that if I can find the scans, you can see my septum is just a knot. It's like crooked as hell. All the bones are all broken, and I think I definitely had some recession due to those injuries. And when I've been pulling on, I feel sort of like uncrinkling or uncrumpling effect where it's opening it in a front to back way, and not an expansion sense. And it's because if you think about like a hose, that's all crinkled, or whatever, an air duct that's all crinkled, it's going to take more time for the air to get through. But if you straighten that air duct out, it can go directly through. And that has been my experience with face mask. I don't even think I need that wide of a base of of my nasal floor, but I think the advancement has been very helpful for my breathing.
So what about your mandible? How has your mandible kept up with the pulling of the upper jaw via the face mask? Because of course the face mask doesn't pull the lower jaw. So
Right.
do you have any idea as to how much advancement you've achieved with the face mask? And then what's happened with your mandible? Has your mandible just repostured itself forward? Was it already recessed to begin with, and so now it's just kind of decompressing from its recessed position in the TMJ and finding a new happy place that's stable?
Yeah, I think there's a combination of all of that. Yousefian did, as I said, confirm tentatively that he did notice in the scans that the mandible was a few millimeters longer. However, I don't know if that's something that will stick, but it does feel as though it came forward. And he did also confirm in the CBCT scan, because we wanted to check that my jaw was not just jutted forward and having an open bite. And he did confirm that the joint was seated correctly in the scan.
So how did your mandible get longer? Was that not as a result of the face
I
mask?
wish I could have a different camera, but I would show you on my desk. Let me try to explain it with Post-its really quick. Yeah, so I guess if you think about the ends of the, I would not show that, by the way.
Why?
Just because the expander, but so if you think about, there's the Invisalign trays, but if you think about the mandible being like, right, and then you have somewhat of a square jaw, right? Now, I didn't have a super square front jaw, but it was definitely not completely round. So there's a little bit in front of that. But if you were to open those up and keep the base of the condyle in the same place, right, they have to get slightly longer because they're rotating outwards, right? So unless you start with a very square jaw, in which case you're not really going to get that much forward movement, you're going to make it mostly expansion. I started with a pretty steep angle here. And so when I even just opened it up a little bit, it's not hard to get a few millimeters of movement in a mandible in the joint when you're already swinging this open. I don't know how much I got it, maybe 8 millimeters. I don't remember what the gap is. And so once the bone sort of hardened, you'll see, pull up the Invisalign photo there, if you can. And at the front of the larger one, you'll see how the lower jaw is more square when I rotate it out, right? So the teeth actually move slightly backwards. They tipped backwards. The forefront lower teeth are the only teeth that have not been bonded. All of these teeth and all these teeth are bonded. But the lower teeth have actually sort of done this motion as the chin's almost come forward like this a little bit. You see what I mean? As the mandible opens up like this, because of the biting forces pushing backwards on the top teeth, the chin has to sort of come this way a little bit. And that's like where people talk about the torquing of the condyle, like that month or two where it was adapting. My condyles were literally like outside of the joint. They were like here. I'm exaggerating, but they were like outside. And I was massaging the actual bone. I was like bending the bone. I had to like, it was very painful and not fun. But it was tolerable. And once I got through that month, it's been completely fine. And the pain has been way better compared to before surgery. So that's
went
sort
through
of my explanation for the, I don't know if that, I don't know if that's correct. And I don't know that the result will stick. It could change and it could recess. But for now, it does seem like it moved a little bit. And whether that's tipping or there is some element tipping, I think. But I do feel, it just feels very different. So that's all I'm going to say anecdotally. Yeah.
Mm-hmm. So you did go through a period of temporomandibular joint discomfort during this process?
Yes, definitely. And that is the reason why I didn't do face mask from the beginning of the expander. Otherwise, I would have, because I know that is a crucial period to be pulling when the sutures are still really open. But especially at night, I could not tolerate the TMJ pain from the face mask that goes on the, that goes on the chin. This guy. And
yeah, why was the face mask exacerbating TMJ pain? Was it just because it's pushing down and back on the chin?
Yeah, that's, I mean, 90% of the force is put on the chin, and it has to go into the TMJ.
Did you consider using a different face mask that wasn't anchored on the chin?
Yeah, so I actually if anyone wants to buy, the bow, I got one. And so I bought that, but it was way too small for me. Maybe I'm too tall, or it seems like it was made for kids. Like I would have to sit like this for it to work. So I tried that out, but I've been using this mostly during the day, and so I have it tied to this. It's a sack strap that I kind of put on a resistance band. Mm-hmm. And I just hook it on there. And so during the day, whether I'm pulling it with my hand or it's tied to my foot or the desk or whatever, it's pulling forwards off my chin. And, I just wore it last night, and I hadn't worn it in a few nights, and I only used 5 bands in total, which is low for me, given how I have 4 attachment points, it's not a high weight, but it's still really put a lot of pressure on my TMJ. And if I use a face mask if I pull it away from my face, I have none of that issue. And I did notice, so I was using quite a bit higher of a weight, pulling weight, and I was up to, well, I don't really want to say, but yeah, I was up to a lot of weight, and I did try that at night. And someone mentioned the chin cupping effect in the Discord or something, on the mandible, where people have a mandibular overgrowth of some kind or something, and they're trying to get the mandible to shrink, and they put this chin cup that is putting the same force vector on your chin, right? And it shortens the mandible from the point of the condyle as well as the front of the chin. And like I said, I only did hard pulling for 1 week. And after that, the the bone here was so thick that it was like becoming like, sorry, the skin and muscle that was attached to my chin was like becoming calcified almost because of how much pressure is being put on it. And then the bone also was like thickening up as a response to try to compensate. And I also noticed that my condyle sort of bent a little bit during that process. So I completely stopped doing that weight unless the weight is off of my condyle and not resting here. Otherwise, I only do a few bands.
So what's your
I
goal
really don't
with
want
the
to
face
mess with the
mask?
length. As much advancement and breathing as I can, as I can get. That's the main. You know, I had a OHI of about 20, 25. So, or AHI, not OHI. And go ahead.
Yeah, would you mind smiling for the camera so we can just see what your bite looks like right now?
Yeah, so that's a fake tooth there.
That's a fake tooth, just covering the diastema.
Yep. Yeah. So he made me Invisalign. You know, I had my sister's wedding, and so I wanted to have something else there. And it's still like, you can tell it's a little weird, but most people don't really look that twice at it. You know, they're like, oh, it's a little weird. Someone has some weird teeth, but like, it's not a focal point, I guess. But you know, this community is very focused on aesthetics, so I get it's kind of weird, but it's mainly because of my cant. If I didn't have the cant, no one would be able to tell at all. But because this teeth is so much lower, it's like it's impossible not to notice it. But
yeah, well,
this is very even.
Yeah, the lower jaw is very
Check out
even.
how big this is. Ah, I did not have. I had. Let me get the tray. It just put this in my mouth. This is my lower. It feels like a child's toy. Like I feel like I could swallow it. It's just so like.
That's your before tray.
It's ridiculous. Yeah.
Can you put that, overlay that so we can see that in your mouth?
Oh well. It's probably better to take it out, but
okay, whatever you want to do.
Yeah, I mean, I think pulling up the photo is probably better, but I'll just take it out here. So
this is the photo he's talking about. So in this photo, how do you have these lined up? Why does it look like the lower jaw was advanced so far forward?
That is not representative of the position of the jaw. I was just putting him on the counter to show the width difference, not the length difference. If you pull up, I'll just send it again, but somewhere in the chat there's a photo.
In the Discord?
From the side. Yeah, I don't know. Oh, here it is. I'll just post it again. I tried to line them. That one. Actually, go down again. Go down.
Oh,
yeah,
right
that
here.
Right one. Yep. So that one I was trying to line up perfectly, and that's more representative of the change. That's a few millimeter change. You see that, right? And that I really lined up the back teeth as much as I could, which is still not representative of the actual mandibular changes because the teeth have moved forward. These teeth have moved forward, and then these teeth tip slightly backwards. But I think that's a better representative. That the top photo was just me trying to show the general size difference of my palate. But that I think is more representative of maybe what the change is, which is a few millimeters. You know, if you really look at what a few millimeters looks like on a ruler, it's not that much. But like you say, it's a game of millimeters. So
yeah, what's been your experience in terms of the sort of your proprioceptive experience of having the lower jaw expander? Has that had any effect on your tongue space or your airway, your ability to mew? What's that felt like? Or do you think you could have done without the lower jaw expander?
Oh no, not at all. I mean, look at the before photo. Look at the before photos. You can, yeah, my overbite was just so uncomfortable, and both jaws were recessed, but the lower jaw was definitely more recessed. I was just doing MSE. That would have been ridiculous for me to do.
Could we see any? Can we see any of that in this photo? what you're talking about?
Yeah, I mean, I think if you zoom in on that left side on the bottom where the lower jaw is clenched,
This
it's not the
one?
best photo, but yeah, the next one onto the right. But they're both pretty obvious, I think. I that lower, I had severe lip incompetence, right? Because there was just my lower, like one of the things that my dentist said to me was that it's when someone just opens their mouth, like, hey, I just do this now. And if I just open my mouth, it's much easier to see my teeth because they're pressed against my lips now. But before, if I open my mouth even like that wide, you wouldn't see my teeth at all.
Mm-hmm.
And so it's like pulling the skin taut in this direction almost.
Right.
Which is why I tried as hard as I could in that photo there on the right to keep my lips as in a natural position as I could in both of those photos, and you can clearly see how much my lips have come outwards almost. I don't feel like before I couldn't rest anything comfortably, partly because I had zero nasal breathing, but also because of the joint dysfunction and the bite dysfunction.
This photo, is this a different?
Just,
are these different lenses or what's
I
going
mean, they're
on?
different cameras probably, but
Mm.
like I said, they're not. I'm not trying to reproduce. I couldn't reproduce like the exact photo for all these. I'm just taking photos and I'm like, whatever. But
I mean, this looks like two completely different people.
right. And I think that if in the top one, I think if my eyes were looking at the camera, it would probably look different.
Right. There's a lot of, so whenever you're doing before and after analysis,
yeah,
and it looks this different, you do have to sort of question about how many variables have changed between the before and the after.
there's so many
Clearly,
that have changed.
the
Yeah.
eye contact has changed. That's affecting our impression of the photo. This one looks almost like it was a higher focal length lens. This one almost looks like a 3X on an iPhone, whereas this one maybe was like the regular 1X. This one almost looks like
they're all single. They're all lens. There's no like actual zoom lens involved. I just cropped the photo.
Okay. Hey, just for kicks, we have someone asking what all of this cost. Can you share a rough number,
Yeah.
on that?
So I think. So including his whole ApnoDent appliance or ApnoTX appliance, which he does for most people with sleep apnea, which it's sort of included in the price, which which you could have some issues with depending on who you are. But I didn't find that much of a benefit from using that device, but I think some people could. And then so including the Invisalign MSE, MSDO installation, and then any sort of follow-up Invisalign, I think all of that was around 19 or 20,000, and then that is not including the surgical fees or the cost of the two bollards. So I think that was probably about 5 or 10 more on top of that. So 20 to 30, depending on what you're getting in combination.
Wow. Tell us about the bollards that you have in the cheeks. What's the point of that? And what physically is that? And what is the point of that?
Yeah. So pull up the CBCT. That's the clearest photo you can get. It's basically it's just a metal mount with 3 screws in it, I believe. It's sort of right sort of in between the zygomatic bones and the maxilla. And in some other photos, you can see it sitting sort of in the sinus. It's similar to how the MSE screws can sit in the septum. And I'll show you here, they're sort of coming out directly out of my skin.
Show us that one more time.
Yeah.
Wow, that's gnarly, man. So
so there's little buttons, and yeah, so it's an open wound. It's not in a similar way that the MSE is an open wound. However, with the MSE in the mid-palatal suture, there's much less blood flow there, and there's much less of an issue because it's not always going directly into the sinus. It might be just going into the septum. But this is going into the sinus. But I have not had any major problems with it. It was the most painful part of the recovery, though. The MSDO were a piece of cake. I had very little pain areas. However, because they flayed open this entire, they did sort of not Lefort cut of the maxilla, but the just the gums, and to flay them open and then put the bollards in. And so that part of the recovery was brutal. And it also really makes me not want to do MMA because I know that it's going to be worse than that.
So what are these for?
So we discussed putting, doing basically wanted to do a face mask. And so we have the attachments on the maxilla. And part of the MSE that I'm pulling from is attached to the teeth, right? So I'm getting a little bit of, there's two places where I can put the rubber bands, and I haven't been using the ones where it advances the teeth as much because I've felt pressure on the front. He's also got, if you pull up go to the other CBCT from below.
This one?
There's one in the chat somewhere, but it's okay. So
this one?
There's two places where I can pull. Yes, that one. Yeah, so zoom in on that bottom left. Yeah. So you'll see those side arms there kind of are looping into the teeth where they're bonded. All the teeth are bonded, and then there is this box there is an advancement screw. So it's pushing against that middle MSE screw and pushing the teeth forward. And so I only did this like a few millimeters, and I felt too much pressure in the teeth, and I was like, I'm not doing this anymore. Yousefian wanted me to advance more, and I'm like, I'm not advancing more. I do not want to lose that bone any more than I already have with Invisalign and all this other crap. So I have not turned those anymore. And then
pause.
So sometimes I
can
pause.
Yeah. Thank you. So that screw that's pushing on the front teeth is where? Is that this? No.
The screw or the advancement, the turning screw?
Yeah, the thing that's...
The turning screw is the square, a rectangular thing on the edge of the... Yep,
this.
go ahead. So that's the middle expander. That's the middle expander right there.
What do you mean the middle expander?
So let me just screen share so I can explain it.
Yeah,
hold on
please do. Please do.
Sorry about that.
That's okay. So just to be clear, so I know Dr. Yousefian often recommends that patients do a MARPE anchored dental expansion forward of the upper front teeth along with the MARPE or the MSE.
Correct.
so that the upper front teeth can get a little bit advanced. He usually recommends SFOT be done prior to that dental expansion occurring. Is that what and I think he calls that tapes. Is that what he presented to you? Was that dental expansion of the upper front teeth with SFOT, and then you tried it and you didn't like the way it felt, so you wanted to do the face mask instead?
No, so we didn't. I have not done SFOT at all. And I do plan on it. And like I actually said to him, I'm not comfortable moving the teeth anymore without doing SFOT first because of how little bone is there. So in my case, because I had the bollards and I wanted the MSDO done, I wanted it all done. I wanted as few surgeries as possible. And so for that reason, it would not have been feasible to do the SFOT as well on top of all the other stuff. It would have been hard for it to heal properly. So we're going to do that later on once I don't know, maybe in 6 months or 8 months, I'm not sure. But yeah, the bone was pretty thin up front, and I'm not trying to lose any more of that.
Okay, so so why does your expander have screws for pushing on the front teeth then? And you just said that you did have some pressure on your front teeth, and then you backed away from that. So can you explain what that was all about? Maybe I misinterpreted.
Yeah. So those.
Do you want to do the screen share? Do you want to do the screen share?
Yeah, I'm trying to pull up Discord. Here we go.
Take your time. Just take a moment
Yeah.
and focus on getting that set up. And
Yeah, I'm all over the place. I get it.
no, you're I'm all over the place. Totally. I mean, there's so much to talk about here, man.
I
And
know. Yeah.
I have a billion and one questions, and gosh, I mean, I don't even know where to start.
Yep.
It,
Go ahead.
someone is asking for some before and afters. Let's see if I can pull something up. Do you have any before and afters? Yes, let me pull that up. I've shared this before already, but I want to ascend. Here is some before and afters. Okay. And then we have CBCT after. You can see the massive split of the upper and lower jaw. And that's really what makes Ethan's case special, is the fact that he did a lower jaw skeletal expander, which is quite rare. Usually we're only seeing upper jaw expanders, but of course, if you expand the upper jaw as much as Ethan did, it's very hard to get the lower jaw to match without doing a matching upper jaw skeletal expander. There you can see Ethan is it's probably at the after all expansion has been done. Is that what we're looking at here?
Yep. Yeah, that's
Now,
directly after. It has shifted a little bit since then, but yeah.
Now, Ethan, just curiosity, why do you take all your photos at an angle like that? That's not, I mean, obviously that's not the cant. That's just the photo is angled, right? Why do you do it like
No,
that?
it's well, like I said, I'm not, one, I moved houses, so I couldn't, exactly, and I have a different phone camera, so I can't reproduce the exact photo. And I was just taking a selfie just to show to show you the gap. I'm not, but I mean, if you look at the scan, it's obviously not just me tilting the
No,
phone. Like
of
my
course
skeleton
not.
is, yeah, but that's just a photo that I took, you know, randomly on my phone. There's no reason.
No, well, I appreciate you taking the photos anyway, because this is
Yeah, I
an
have some
incredible case to
more.
document.
Yeah, I have some more lined up ones, I guess you could say. But
Question, this airway photo,
yep,
what is the before and after here? Is the before any treatment, and the after is after
yep,
everything, including face mask?
yeah. The before is December 2022 when I got the initial scans and went in for the basic stuff. There's no Invisalign movement has occurred in the lower teeth in that. Nothing at all. There's nothing. So that was my default. Yeah, and the after is April 2024, 2 months after the surgery. And there's no, like I said, there's no. I'd not done face mask up to that point whatsoever.
So this is
So there's
all
no
in
advance. That's
no
all. Yeah, yeah.
advancement from the skeletal expanders.
Yes, and I had not turned any of those teeth, the dental advancement screws either. It was only the MSE expander and the MSDO expander. That was it.
Mm-hmm.
So just from those two, the breathing benefit was great, and the oral volume increase was amazing.
Mm-hmm.
However, the nasal breathing has been improved so much since I started doing the face mask.
Interesting. No one really associates face mask with improved nasal breathing, so that's
Right, and I
kind of
think that part of it is the actual anatomy of my septum that's broken, and the injuries that I've had. Like I said, that like uncrumpling effect is, I think, can be very helpful in my
yeah,
case. But
yeah.
like I said, if you have a straight septum, like that probably won't help that much, aside from creating breathing space behind your upper, like in your rear airway.
Right. You were saying
But
that your septum is so damaged from injuries earlier in life that it was kind of crinkled up, and that the face mask kind of stretched it out and dekinked it. Is that what you were saying?
Yep, and it's very minor, but I do notice some changes in my nose from both the profile and the front. But it's, again, very minor. This side of the bone, though, has been rebuilding. So I think something about when I moved the left side, when this side mostly got expanded, there was something where it changed how the nasal bone connected to the zygomatic bone almost, and this side, the bone was very thin before, and it's been building up, like, and instead of, it was sort of like this side was bent because I broke it this way, and this side was sort of kinked inwards. And so when I brought this side out, it sort of bent this way slightly, and it's now more straight instead of kinked. Does that make sense? But that has been my experience with the face mask, which I don't know if what I was expecting exactly, but I probably wasn't expecting that, to be honest. Like you said, most people do it for you know, and like when I brought it up in the Discord, everyone was like, I thought face mask is just for aesthetics, and it mostly is, unless you can get significant advancement from it. But man, when I went into Yousefian's office like 2 days after I started the face mask, right when I went in to get the Invisalign and the fake tooth, and I was like, Yousefian, like, I don't know if this is, I'm tripping here or something, but like the breathing, and I was only using like 4 bands or something. I was using very low weight. And I'm like, the breathing has been insane the past few days just from that. And he's like, you know, no, it's anecdotal. I'm like, I get that it's just anecdotal, but it was just, my breathing has been so bad for so long that when you experience something like that, it's just like, even though it's anecdotal, it's very, I think, significant information. And I'm not complaining. I'll leave it at that. But I don't know, like, you know, there really can't, because of how unique my situation is, that it's very difficult to have any sort of data whatsoever on that type of effective face mask at my age, with, you know, 26. So
yeah, it almost reminds me of the question of whether or not jaw surgery improves nasal breathing, because, you know, when they do the Lafort cut and they sever the upper jaw, right? They then have access to the septum into the inside of the nose, and it's at that point that the surgeon might perform a septoplasty and straighten out the septum. And then when they, you know, pull the maxilla forward and plate it, then the maxilla heals in that forward position, and the nose has gotten longer and bigger in a sense internally, and potentially the airway volume of the nose has increased, or the interior volume of the nose. I wonder if, and people do report having significantly improved nasal breathing after jaw surgery, even though the conventional wisdom is that it's MARPE that's needed to improve nasal breathing, right? Or ease, or, you know, take your pick of whatever MARPE, whatever the flavor of the day is. But yeah, apparently pulling the maxilla forward does improve nasal breathing. You experienced that with the face mask. So it's an interesting observation. But how long were you wearing the face mask for when you had that change in nasal breathing? Just a couple of weeks, you said, right?
Well, like I was 2 days, like 2 days.
So, but then how does that work? That
I
doesn't
don't
make
know.
any sense to me.
That's why I don't know. But I will say that my sutures have stayed loose extremely long for a male my age. And that could have something to do with it. But I said to him, like, when I came in, I was like, I know this is like sounds weird, but I really didn't have that much of an increase when I did the MSE. It wasn't like, it was better, but it wasn't like, oh my fucking God. But then I started doing the face mask for, like I said, 2 days. And it's just, you know, maybe people think I'm lying or making it up, but that was just my experience. And I don't know why that happened, but the more weight that I do on face mask, the more the more benefit I'm experiencing. And so I'm not planning on stopping it until I stop feeling a benefit, and then I will maintain for at least a few months once I stop. Because even if my maxilla comes way too far forward, I'm okay getting BSSO to match that. But I might not need to. But
you would be willing.
I'm worried about it. Go ahead.
You would be willing to pull your maxilla so far forward with the face mask that even if it meant that you would need jaw surgery on the lower jaw, which is BSSO, to advance your lower jaw to match it. That's how important it is to you to get that maxilla pulled forward.
Yeah, and that's just me. That's my specific case. Yousefian did recommend MMA, double jaw surgery with the sliding BSSO and a 3-piece Lefort, I think, of the maxilla. But like you've mentioned before, there's no way of changing any of the eye or the nose really when you're cutting the maxilla away from the zygomatic bone. And to me, that connection between the zygomatic bone and the maxilla is a very important connection. And one, because of the roots of the teeth are have their blood supply right there, and that freaks me out a little bit. And MMA is very well known to cause issues with killing teeth and and same thing with these surgeries, to be honest. Anytime you're cutting bone around teeth, like it's pretty dangerous for the teeth. But where was I going with that?
Big picture. Yeah. Let's go back to zero here, right? A lot of people wonder, how would transverse expansion of the upper and lower jaw affect me functionally and affect me aesthetically? Overall, are you happy with the way things turned out? Do you like the way you look? I like the way you look. I mean, with your lips closed, at least. Obviously,
I'll shut up, Ron. I know I'm talking too much.
No, you're good, bro.
I'm kidding. No, obviously, I know what you mean. The top teeth look ridiculous. Yeah, for sure.
Well, you've got at least a year to 2 years of orthodontics to clean that up. Believe me, yeah. I know. I'm in my 5th year of post MARPE orthodontics, so I get that. And I think one of the harshest things that happens in this space is that people judge MARPE aesthetics based off of smile photos of people midway through their treatment where their teeth are a wreck. And I'm just like, well, he's got another 2 years of orthodontics left. It's got the teeth are going to be straight at the end. So really what we should be judging is the closed mouth posture or the closed mouth profile. So, but I want to give the floor back to you. Overall, are you liking the effects that this has had on you? Functional, aesthetic?
Yeah. Definitely. Absolutely. Like I said, my main goal going into it was to fix my fucking sleep apnea and stop choking all night, which I think has some effect on my appearance anyway, even if I don't expand. But yeah, that was my main concern going into it. So from that perspective, it's definitely improved, even despite the fact that I have all this metal in my head still. My breathing is still way, way better from before surgery. And surprisingly, like I said, my TMJ pain has been so much better. There's been virtually none, unless I use the face mask resting on my chin. My bite feels, even though I had this giant gap here still, like my bite is just so much more comfortable. Like,
can you show us your bite
everything
again?
Yeah, you want me to take these out or?
Yeah, take them out. I'm just curious to see where you're really at right in this moment.
Yeah.
Step back from the camera and show us that from from right there-ish.
Look like fucking Frankenstein over here, or like a squid or something.
Hold it there. Hold it there a little bit longer. I just want to see the occlusion. Huh. And peel the left side open a little bit more so I can see that side.
Here, I have a tool.
Wow. Incredible. There it is, folks. You want to see what MSE and MSDO looks like? There it is. It's real. It happens. It's not just a theoretical treatment. It's out there happening in the real world, and
it's not a fairy in the woods or some shit.
Yeah, exactly.
There you go.
There you go. There you go. I know that tool.
Yeah.
What's going on with those lower canines? They look a little jacked up, no?
Mm-hmm. Yeah, like I said, these have because of all these teeth are bonded together connected to the expander, and so as the jaw rotated outwards to match the expansion of the maxilla, the teeth had to kind of come out a little bit, but it if you look at the scans, it's not actually that much teeth tipping. It's really the mandible rotating outwards.
Interesting.
And because if you look at the before and after, the one clear thing is that my jaw is more round. Basically, it's actually less square. So you're not going to get like the sort of wide, what is that called?
The
I don't know
ramus?
what sort of angle. Yeah, ramus angle. Well, isn't this the ramus, or is that? I don't know. Okay, yeah. So the ramus angle, and then how much the actual point of the jaw sticks out. So even though I was more recessed before, it was slightly more pronounced. And it, like I said, if you're taking it like this and you're rotating it inwards, the rear part has to get slightly smaller. So for me, it hasn't impacted how I look that much, in my opinion. Like it would have been nice to keep that, but I don't care that much. Like it's just breathing benefits I'm looking for. But in most of my before photos, I don't have the swelling from the bollards, and I'm also 220 pounds now, and I was like 160 in some of those before photos. So I have a lot more just water and fat on my body.
How did you gain 60 pounds?
So my normal weight is about 195.
Okay. How tall are you? And by the way, how tall are you and how old are you?
6'1", 6'2",
Nice.
it's a half, whatever. Yeah, and I'm 26, and so, sorry, remind me where we're going.
The weight.
So I'm normally about 195. However, so this is right when I initially got a consultation with you, was when I was having super bad TMJ pain, and of course still sleep apnea. And so I was taking kratom like 3 times a day. And, I was, self-medicating pain, but also like mental health issues and shit. And so that stuff really shuts down your hormonal production. Like when you agonize the opioid receptors like that, it shuts down the hypothalamus pituitary axis. And so there were several things that were going on there where it was just not good for my body. And then I was fasting a lot, basically to compensate for a lot of the health issues that were happening, as well as trying to get my sleep apnea as good as I could. But, it didn't really help for me to get down to 165 at 160 at all. Even it was the same as when I was at 195, which is around my normal weight. And so I didn't actually gain that compared to my normal weight. But I did gain. So we didn't talk about this on this live, but I have been on hormone replacement therapy for a year, or give or take a plus. And so that part is partly what helped me gain a little bit more. But if you look at me in the street, like I look very natural. So one of the reasons I did that, I find this interesting. Maybe people think it's a little strange, but there's a very well-known effect. So I can start with this. So, a lot of you guys notice that men and older males have a harder time expanding the maxilla, especially if you don't do any mid-palatal cuts on the suture. And so part of the reason for that is their sex hormones, and testosterone is very well known to increase bone density, increase the strength of the bone, and it becomes slightly more brittle as it gets more dense. And women have less dense but more malleable, sort of soft bones. So especially as you go through menopause, you can experience osteoporosis, and people experience bone loss. And so I'm in this community, the idiopathic condylar resorption group on Facebook, because I had a little bit of that issue. And 99% of the people with that issue are women. So I was like, huh, so I know all these effects about, I know the effects that testosterone has on the bone density. And so I already had retractive orthodontics where my teeth were just put through the ringer. And so that, like I said, that dental alveolar bone is so thin, and I was trying to preserve that as much as I could. And so, that's why I decided to get on that. And I have done it before, so it's not like my body has been, it's not like I've gained weight before and lost it and gained it. And I've been on testosterone and off of it, and I've come off of it. Like, when I got off, I did it for a few months when I was like 19 or something. And then I haven't done it since then. And
do you think you'll stay on it, or was this just something to get you through the bone growth that's going to be needed, or the bone repairing that's going to be needed to fill in those big
ideally
gaps?
I'll get off of it. Yeah. There's some, like, I'll say, like, a lot of people, I understand why a lot of people think that someone would get on that for insecurity reasons, and I'm not immune from insecurities at all. I have my insecurities, but I think that I could have taken a lot more, and I could have gotten a lot bigger, and a lot more muscular, and I chose not to because it's not the main goal. And you could choose to believe that or not, but for me, I'm really trying to. So let me fully explain what my thoughts are on the hormones. So what I did for the year before the expansion was I tried to harden and strengthen around the teeth and in the jaw in general, just as much as possible, because I know that anytime I go through a surgery or expansion or I move teeth, you're going to lose bone. You have to think about that every time you go to some random orthodontist, and they just crank on your teeth, and then you're like, oh, I want to go to a new one. Like, you just lost a few millimeters of bone. And so I was really trying to build that up as much as I could. And then so when I actually had the surgery, I completely stopped all androgens, right? And I just did a low dose of HCG, which is basically just stimulating my testes slightly. And so when I purposely did that because of the effects that I noticed in men versus women, when going through these surgeries, and then also with bone growth and bone loss over time. And so I was really trying to manipulate, the bone is going to weaken in the week. It's going to weaken in the weakest parts that are already there. The weakest sutures are going to be the first thing that weakens, right? And the thickest bone is going to stay there longer. So when I did the surgery, right, that the cuts were obviously loose, but then once I brought that androgen level down, the sutures, whether it's the ones that connect the zygomatic bone to the TMJ, or the maxilla to the zygomatics, or whatever, all those sutures loosened slightly. And I experienced, so you see people on high amounts of steroids, right? And their brow bone is high up. They're very, like, you can see the features in their face popping, and that is actually the testosterone laying down new bone in that spot. And the same thing happens to trans men who go on testosterone, or women that that take testosterone. They get masculinizing features. And so when I went off of it, the opposite happened. I was like kind of scared for a little bit, because I was like, wow, my jaw is getting thin as hell. And so right when I was done with the expansion, I put a moderate level of testosterone back in, and immediately the bone started thickening up. And so I also have been doing low dose growth hormone throughout that, because that also aids in the recovery of the formation of new bone.
But the androgens, the HGH and the test, that works against the face mask, or does that work with the face mask?
Yeah. So someone asked about that. I think in my case, I don't think it works against it, but I think it does generally, yes. But I think because when you're going through the mid palatal suture cut, I think that might play a role because of how much looser it is, even though that none of these other ones are loose. I think that because I had so little bone in the back of my palate that he had to make a special 6-screw MSE for me, because he normally does a 4-screw one. So I have maybe because of the injuries, but I have so little bone in the base of my maxilla that there's not that, like the what is it, the pterygomaxillary suture. You know, I don't know how thick that bone is anyway, so maybe that's why it's just very loose. But the other thing that I initially just did for pain, but I maybe speculate could have an effect on sutures, and it did on the lower, but is I've been using this. So people are familiar maybe with the bone smashing sort of community or practice. I don't know, it's not a community, but where they're, some of these guys will literally just like sit there hitting themselves in the face. And I've done that before, and I don't know. Like I just did it. I was doing it on my nose because I was trying to like break it the other way and try to open it up or something. Like, I saw a video of an old Russian guy they took a 4x4 and he was drunk, and they put a 4x4 and they smacked the septum the other way, and they like so anyway, that didn't work. But I started using this on my muscle, right, just for pain, and it didn't really help that much. Like it helps a little, but I started doing it on the bone itself. I did this for a year before the surgery, and I did it throughout the surgery. So I would do like,
Which
thumb
surgery?
pulling.
Which surgery are you talking about? Just to be clear.
I only had one surgery, and it's the MSE-MSDO bollards. That's the only. I mean, I had my wisdom teeth out, but that's it. I had no other facial surgery at all.
And just because I don't think I got this question answered before, the bollards were put in strictly as face mask anchors?
Yes.
That's their sole purpose in your face mask anchors?
I mean, what else would they be for? Yeah. Right. No, there's no.
So when you wear your face mask, show us all of the places where you connect it in your inside of your mouth.
I'll put it on rubber bands. So I have this little hook. Where's the hook? Anyway, I'll show you later, but I have this other hook. So instead of putting it,
yeah, go ahead.
Instead of tying these onto, one side is going to be the tooth attachment where it's bonded to the teeth, and the other side is going to be the MSE screw. So instead of doing that, I put a small metal hook on the MSE arm, basically. So I'm only pulling on that MSE arm and not half the tooth and half the teeth and half the MSE.
Can you show us?
I don't want to. Just I can't I signed some stuff.
Okay.
So I can't show the expander, but I wish I could, but I can't.
Okay.
So I'll just attach it. So this loops around one side of the expander, and then this one goes around the other. It's pretty easy once you get the hang of it. To put it on, and that. So I have usually like 4 on each, or depending on the day, each side, and then.
So you're going up and you're grabbing the bollard plate with that elastic?
Yeah. So it's a little knob there, little button, and then this goes here.
Wow.
And now it goes there. and that's it. And then, you know, I'll attach it with this, just like that. Oops, like that.
And that's an exercise band.
Yeah, and then a sax strap hook. And
What's
then,
what's a sax strap? For
oh, like a
saxophone?
saxophone. Yeah, like yeah. And so this actually works great. So if I'm sitting down, I just loop it around my foot, and it puts a great amount of pressure, and it pulls slightly downwards, as you see from both of them.
Is that what you want? You want to pull slightly
yes,
down?
and Yousefian specified that he wants me to pull down because I have a naturally shorter face. So any sort of lengthening effect is a good thing for me. So I have been pulling down quite a bit, and it feels great. When I pull upwards, if you're pulling too high, you're always going to put pressure on those front teeth. Even if you have no, advancement screws like MSE or like Yousefian's MSE device, I don't want any more teeth tipping. So I really am only trying to get forward and down, to swing it.
Yeah, you have to get under the upper incisors so that you don't hit them with the elastics. Wow, man, that's incredible. What does it feel like when you step on the elastic and you get the full force? Do you feel it in your face? Where do you feel it? Can you point?
I mean, it's just inside my face. Like it's like behind, just really behind my nose. I mean,
you feel
when I pull on the bollards.
Yeah.
Yeah, it's like it's so hard to describe what it feels like. But
does it
feels
almost
good.
feel
I
like
mean, it just feels like it's opening up. It feels like it's opening up. Like it feels like it's like a Ziploc bag that just went like this. Like I don't know. I also feel this specifically right here, right before I started doing the high pulling strength with a higher amount of bands, higher pulling strength on the face mask. I didn't feel this bone come forward as much, but recently, since I've been pulling from just the MSE, it feels so much denser right here. So this whole area just feels tighter, and that's how the best way I could explain it. It's just moving. I think it is moving forward. I mean, I don't know how else. And I do notice that I have more of an overbite now than I did 2 months ago. So I do think I feel it looks, just anecdotally, it looks different when I look in the mirror. Sometimes I'm like this. I feel like almost different, like a different person. Like not, I don't know, just partly because my breathing's so much better, but my face just feels so much different. In a good way.
How has all of this expansion affected your ability to hold good tongue posture, or some would call it mewing?
Amazing. I could not mew before at all. I couldn't nose breathe, even if I could mew. I had zero tongue space. My tongue was falling back. And oh my God, I can do almost all of my workouts, and I can do through my nose now. It's wild. Like I could not do that ever before. It was just like that before. And like I could not do that before. Even if I cleared the hell out of my nose, and I blew my nose, and I, did tea tree or whatever, peppermint oil or whatever the hell, like to open it up. None of that did anything, because it's the structure of my, the bone was all messed up.
Yeah, I had the same experience with my MSE. Did the lower expander have any effect on your ability to have good tongue posture?
Yeah, I would say that because I did not have enough tongue space before to even fit my tongue. This is, I mean,
We're
look at
talking
that.
the
Like,
lower jaw now.
look at the size of my tongue. Like that's
Yeah.
it's time. It's just, but one thing that it's sort of, it was almost like a, what is it? Is genioplasty, but where they take that little chunk out and they slide the muscle forward. You know what that's called?
I
think it's genioplasty.
I know what you're talking about, but yeah,
not a sliding genioplasty where they slide that forward, but they cut it. It almost had that sort of effect where when the first month, it like the muscles that connect, because there's all these muscles and tendons that go from your clavicle all the way up to your chin, and so those muscles, even though it was barely expanding the lower a centimeter or less, it was like I couldn't even tilt my head up. Like I was like this. Like it was so tight that
Wow.
like it would pull on the or tighten the expander itself if I raised it too much. So slowly over time, I was just doing, these like stretches to open it up, and I had to do the massage gun, and you know, it took a while, but
Genioglossus
my muscles
advancement
were
is the
so tight.
procedure.
Yeah.
Do you feel like those muscles that you're describing, or some structures maybe behind the muscles, do those block the airway if your lower jaw is too small or too recessed? And did you feel a distinct airway opening as a result of blowing open your mandible?
I
Or did you
think it
do
feels.
did, did you do the upper and lower jaw expansion at the same time, so it was kind of hard for you to parse out what expander did what in terms of outcomes?
Yeah, definitely. It makes it harder yeah, or definitely. But I'm taking more of a shotgun approach and trying to, because I don't care. I'm not trying to be a research subject. Like I'm just trying to get my breathing good, and I don't care how controlled all the variables are. I'm just trying to get, and that's why I'm doing all these health protocols and the hormone stuff. It's like I'm really trying to optimize the surgical results, because I've heard so many cases where people do face mask and they have relapse, and I really would prefer that not to happen. And same thing with MSE, even if it's not relapse, like they can kind of move backwards without face masks. So I'm hoping that once I go through, once I reach the maximum breathing benefit is when I'm going to sort of consider myself done with the treatment, but I'm still going to maintain face masks just to keep that bone forward. And for about, I think, 2 or 3 months, I'm going to up the dose of testosterone and then also growth hormone to really thicken it because, you got to think about, like, your bone is always going to get thinner as you age. Your airway is always going to collapse, right? So whatever this result is going to be the best result that I'm ever going to have. And so if I can, even if it looks a little weird and my face mask is so far out that it fucks up my bite, that's not going to stay there anyway. Like if I take 5 years after the surgery, I doubt that would stick anyway. So whatever chance there is that it will stick, I'm trying to sort of cement it in place once it's there. Given how old I am, because my growth plates are just closed, so there's no way other than laying down an abnormal amount of new bone in the area. I'm more comfortable with it than without it, personally.
So
but
you're doing that you're talking chest
no
and
one has to do that,
HGH, right?
Yes, and I also did a little bit of sublingual anavar. I didn't like how it made me feel mentally, but there are some people in the bodybuilding community where they'll do sublingual absorption of an oral steroid that they normally would take in a pill, because it's better on the liver. It skips the liver first pass metabolism and goes directly into your bloodstream, but it's entering through the mucosa in the mouth. And so people will experience, when they go on when they start doing a sublingual anavar cycle, for example, their tongue will get thicker, right? And their face, that happens on all androgens anyway. But similar to how, people have like topical finasteride or topical minoxidil versus oral minoxidil or oral finasteride, there's somewhat of a localized effect that occurs with some of these medications and hormones. So it's still going systemic, right? I'm still absorbing it. But I did that a few times, but it was not a consistent thing that I did. But I may do that, in the future, but I think overall just having a high enough androgen level is more than enough. I don't think that,
Can you,
but yeah, other than that, it's just testosterone, GH.
a few more things. Could you show us live on camera your side profile from a short distance back?
Yeah. So do you want me to I'll do one where I'm forcing my TMJ back into like an abnormal position, and then I'll do one where my bite's comfortable.
Okay.
So
What's that one? Is that recessed?
That's that's the where I'm like forcing it back.
Okay, show us that again.
Is that good?
All right.
Am I tilting my head?
Yeah, now show us the comfortable one. And when you say that's comfortable, you don't think that your lower jaw is dislocated too far forward there? That seems like a sustainable position for you?
Yeah, that's how I chew. Like I don't like to force it that far back. I'm just trying to be scientifically a little bit more accurate than just taking a random photo. So I am trying to exaggerate how far back it is as much as I can in that. But when I'm chewing, like that's my normal chewing position. It's not here. Like that's pushing it back, and that's more normal. So it's only a few millimeters, really. But like that is not somewhere that I would like rest my mouth when I'm chewing, or if I'm like clenching during the day. I'm like at the computer. They're just resting here, and that's my comfortable bite. Like there's no comfortable bite that isn't there. If that makes sense. If I move it back, it's uncomfortable, and it's only my molars in contact.
Can you show me one more thing?
Bite.
Could you screen share or send on the Discord like just a regular old before photo of you just in a candid position so that we can compare that to like how you look on camera right now?
Okay.
I think people are trying to get a sense of how, the real before and after here and how these treatments have changed
here,
the way
I'll get
you
the
look.
one in Yousefian's office because even that photo is not that controlled, but it's a little more controlled. Let me try to find it.
My guy. One love to Dice.
Oh, it's probably in this.
And you haven't actually shared anything yet. I'm not sure we know if the permissions on your browser are going to allow it, but maybe if you could get your sharing working, you might be able to show us some stuff.
I am trying to find the right photo because there's one that he took in the office, but especially if you look at those before and after photos that I posted, like you can see how much like how puffy my face is. So it's definitely hard to get a sense of like where the like maxilla zygomatic connection is because of how puffy it is with the bollards and the weight. But I'm trying to find the photo. It's gonna take me a minute. Sorry.
Or if you have honestly any candid before photo would be fine.
Because I don't have a lot. I don't take really photos of myself. I'm just doing this to document it. But most of them are going to be if I'm like smiling. But I can find them.
Yeah, just anything.
I was looking the other day for one where I'm not smiling because I'm trying to find one that's like more that looks like the other one. But
Camillo, definitely, bro. Would love to have you on if you want to showcase your experience with expansion. I remember we spoke. I'm very eager to hear how things have turned out for you and what you look like now and how you feel now. Email me. All right, email me and we'll set something up. If you want to come on for a live stream, I can definitely make that happen. And I'm sure everyone would love to see a good case. Thank you, bro. Good to hear from you. Thanks for tuning in.
Oh, this one's not bad.
Share that shit.
I don't know. I'm just gonna find a few different ones. Some from the side, just to get a general sense of my face, because I don't have any like perfect. I really should, ideally you take it in the same house, in the same lighting, with the same camera, same focal length. But
no doubt.
I couldn't do all that. But and even at Yousefian's office, they did sort of the same thing, but the before and afters just don't. They still didn't do them like exact enough, even though it was the same office and same position.
Yeah, pop something up so we can chew on something here.
Okay. Sorry. You too. Okay.
Camilo,
So here's one.
Camilo's coming on, baby.
Oh, honestly, you know what the best thing would be to do is look at the screenshots from when I did the podcast with you last time, because that's the same webcam. That's probably the best thing to do.
Is that still on my channel?
Yeah.
It's got to be, right?
I think it's in the live sections. Like the two that I did were the JawCasts, right? And then I did the one interview with you. But all those I'm bald in, or a shaved head, and so that'll be different. But you'll be able to see how different my face is.
Yeah, it looks like you have a bunch of. You have 4 videos on my channel.
I think one of them is a different Ethan, but
yeah, one of them is Ethan. Yeah, I think this is you. Ethan shares his Dr. Yousefian experience.
No, that maybe.
Yeah, that's you.
Okay. Okay, yeah.
Oh, nice. Let's fire this up. Our hair looks a lot different. Both of us.
Look at you, Ron.
Nah.
Looking great.
Not the best, not the worst. All right, let's
some of my symptoms in terms of not having energy and stomach discomfort, but
yeah, I mean, I can definitely, the lips are the biggest thing for me that I've noticed. My lips just felt so like inwardly turned and just not comfortable at all. Yeah, I'm like watching myself speak, and I can see how much more uncomfortable my lips were. Like it felt like they were like just like, I don't know, it felt like they were very tight or something, but they feel so, it's just, everything feels so relaxed in my face.
Wait,
now.
were you already expanding at this point? Why do you have a little gap there?
I had a natural gap.
Oh.
I have a natural diastema. But yeah, there's a good way you can see my jaw's a little more square, right? It's not as square now because of how when it turned out, right? It like, you see what I'm saying?
Yeah.
It's still square, but it's like if I didn't have a square of a jaw to begin with, it would be way less square. But I'm personally fine with it.
Do you think you looked like Sean Strickland before? With the bald head?
Well, I could see that comparison.
Do you identify with Sean Strickland at all?
No, I don't. No, not necessarily.
He's nuts.
Yeah.
You know what I'm gonna do? I'm gonna load up a different one too. Let me see if
do the ones with Jolly.
With Jolly.
Yep.
Jalib Kwali.
Jolly.
Wow, you guys went for 5 hours on the channel one time?
Yeah, that one was fun.
5 hours? Where was I for that? Was I working?
Yeah, you were there at the beginning, and then I don't know. That was it. Okay, that's a better straight-on photo. Yeah, so you see how steep that angle is, though.
Beta boy.
It's like this, but see that?
Where's Jolly? Yeah, why is Jolly hiding on this one?
He said he didn't want his identity out there.
Oh, come on.
He traffics in some big circles. I don't know.
Little biatch. Jolly. Kid talks to big game. He's guys calls himself Jolly, but it doesn't show us his jaw.
True. I was like, come on, dude, you gotta come on, show your face. But dude, this thing, are you familiar with these stones? Like,
no, that looks like that looks like an Indian flint knife or something. What is that?
Kinda. It's so like I said, I was doing.
Oh, is that a massage stone? Do you put that in the freezer and then you massage with it?
Well, I don't put it in the freezer, but yeah, you could do that or heat it up. But I'm telling you, I was doing the massage gun for a year. Yeah, gua sha. And so I was doing it on the muscle mostly, and then I was also doing the bone. But once I did the surgery, the TMJ pain was so bad, and even with I was doing the massage gun for a few weeks and it was not helping at all. But as soon as I started doing the massage gun and then this, like the pain dramatically improved. And after the surgery, my lymph nodes all throughout my face, I could feel like all these little balls throughout my face where all the lymph was getting stuck, because like it's really adapting to that new position. And this thing for me, it's anecdotal, of course, but just for pain and draining some of this like fluid has been very helpful. That in a way that the massage gun didn't help at all. The massage gun, I feel like, just loosened it up, but it just stayed in my face, and then I got runny nose or stuffy nose, but yeah. So
you think
I would
when these
highly recommend
expansions
that.
occur, it's important to do body work to help the body acclimate to them and to keep, fluids moving and blood moving and to release muscular tension, et cetera, et cetera? Do you think a
Yeah,
lot of the
I think
TMJ
so.
pain that you were experiencing had to do with tight muscles and fluid buildup that was causing sort of a clunkiness? Why would the gua sha help
That's
with your
not
TMJ pain
but that's not. Well, are you saying before surgery or after?
after surgery?
So ask the question again.
So why would the gua sha help improve on TMJ pain if all it's doing
I
is
don't know.
work?
I don't know, but I don't know. But I'm just saying anecdotally, it felt that way. How I think about it is through lymph drainage, and there are several lymph nodes that run throughout the face, and they all sort of, along with the trigeminal nerve and all these blood the arteries and veins, they all connect right in here into the sort of into the TMJ. And since like I said, my condyles were a half a centimeter outside of my TMJ. And so if you think about a lymph duct that has no blood, there's no organ that pumps lymph around, right? There's the blood is pumped around by the heart, but the lymph doesn't have any organ, so you have to move around to drain it. And if you don't, it just collects you get swollen lymph nodes. And that's like when you get sick, it can't clear the lymph quick enough compared to how much is being produced and how much toxin is trying to get out of your body. And so I think, but maybe it could be releasing tension in the muscles since they were adapting to the new position. I don't know, but just anecdotally, if you have TMJ pain, I would check it out. But I was doing massage gun for a while before surgery, and I had a dysfunction that was pre-existing, obviously.
Right. Ethan, I'm going to step away for 1 minute. Could you, while I'm away, tell the audience the differences you see in your own face between this before photo that I'm showing in this JawCast from a year ago versus where you're at now? Like you were saying something before about the lips. Just can you riff on that for a minute? Because it's
zoom in on
subtle.
that.
It's
Zoom
subtle.
in on that face really quick. Okay.
All right, I'll be back in just a second.
Yeah. So, the biggest change I notice in the lower jaw is how, like I said before, how much the tips of the ramus or whatever this is, the angle here has moved inwards, right? Because as you rotate it, it's going to naturally kind of have to come this way. And so I think aside from the rear, the back of the lower jaw, the front of the lower jaw is much wider and more square than it was before. And I think it's also if this is the tip of the chin, it's rotated slightly more this way. So I think the chin sticks out a little more, but hard to tell. It's very minor. If it did at all change, it's a few millimeters. But for me, I think the biggest change in my face is in my lips, as I've said, just aesthetically, because my upper and lower arches before, were so thin that they couldn't support the amount of soft tissue that I had, in my lips and my cheeks. And so when I busted that open and then slightly advanced with face mask, I noticed a lot of this mid-face support difference. And then in that video right there, it's very clear to me, especially the top lip feels like it was more like turned in, like this almost. And then this bottom lip has, if it was like this before, it was kind of spread and brought downwards as the bottom of this became wider. So almost like that motion.
Look who just popped in.
Hey.
Little biatch. Little jolly biatch.
Yeah, so that's most of the changes I experienced.
We should get whole body breathing and Jolly in on this and have a little jaw party. Little bitch.
Yeah.
Fuck this kid. Yo, why is he fucking memojiing us right now? Oh, whole body's in, whole body's in. I'm finna send some invites to Jolly and whole body right now.
Yeah, one thing I will say though about my before and afters is that I want to wait until completely when the surgery is done, and then also when I thin out and lose water weight and fat in my face, because that's the biggest thing it's keeping me from really seeing the difference. Because I had quite a defined zygomatic bone before, and because of how much water and swelling's in my face, it's kind of hard to see exactly how much it's changed aside from the CBCT. But I'll have to see. Yeah, that's right there. You can kind of see. Look how much my chin has changed since then. In that photo. See, look at that. Yeah, that angle there is, interesting. Also, if you play my voice also got deeper, because when I was on the kratom, I was using kratom from about like 18 to 21, 22, and I definitely missed a slight bit of puberty at the end there. And so I think when I did this cycle, it definitely changed my voice. So see how different it is on the video.
All right. Can people hear this?
Play it. I don't think I'm not speaking in it.
There
you go.
Partially, in some cases, will be able to slide the soft tissue.
So does that sound different or what?
Keep it sort of anchored a little bit
or no?
forwards.
A little bit.
And it's often done in combination with other surgeries and procedures for.
I definitely noticed the texture of my voice changed a little bit.
Oh shit! Jolly in the house.
Oh, and he's showing his face.
Jolly.
My God.
Who are you? Who are you?
Who are you?
Yo, I'm the GOAT, baby. Who are you?
Yeah, Ron, cut off that the YouTube thing. Close that window. Here you go.
Jolly, what's good? Where you at, bro? Carolina?
Maryland,
baby.
It's crazy.
Too close to DC though, man. Get out of there.
That's very true.
What's that hat? Tell us about that hat. Is that Pokemon?
No, it's my grandpa's. Boy was in Vegas or something.
Oh, bro, old grandpa hats from the 80s are the best, right?
He's got them all right here, man.
Yo, that's a gold mine, man.
I know.
That's a gold mine. Oh, your whole body breathing's trying to jump in. It's StreamYard, bro. Yo, you and Ethan went off a couple times last year on this channel.
Yeah, we did. I totally forgot about those. Those are like a few hours long. I was like, whoa.
What did you guys even talk about? It looks like you talked about MMA a lot.
Talked about a lot of random shit. You talked a lot about all those boxers and all you're talking about their face shape changing. You were talking about Conor McGregor, all that.
Yeah, we're talking about a lot of UFC fighters and stuff.
Yeah,
that's crazy.
those guys got jaws like crazy, right?
Yeah, they do. It's wild.
Not Amir Khan though. Amir Khan's little slack jaw.
Yeah.
I'm about to pull up the video of Amir Khan getting knocked out with his tiny little weak ass jaw.
Where is he from?
I think he's English, isn't he?
I don't know. Let me see. I'd have to see a picture of him.
Let's watch this. Let's watch this. Am I allowed to show this?
I think so.
Cutting the fifth and doing little here. Another round looks as though it's heading Mexico's way.
Oh, slept.
Look at that.
Oh,
chin,
slept,
chin.
man. When you have no chin, that's what happens. Look at that. No chin.
I feel like that's what's gonna happen to Conor when he fights
Where's
Chandler.
his chin? Where's his chin?
It's gone. He needs he needs MSDO.
Dude, actually, no, I was going to say, dude, I've seen pictures of boxers where they break their mandible here and they can shift. Like when I had the surgery, it was moving exactly the same way. And that's got to be scary as fuck to just have a random crack in your mandible. Oh my God.
You mean from getting punched?
Yeah. I saw one where he was literally like moving his jaw around, like with the split was moving in the same way I could move it after MSDO. It was weird. But there was no like metal bar keeping it together at all. So he was just sliding his jaw around like a snake, like with no hinge at the front.
Right. He probably couldn't chew until he got that fixed.
See, that's what we got to do. We just got to like evolve to become snakes and just we have no need for a suture here. We can expand it forward as much as possible. That's it.
Seems like we're going the opposite direction though.
You're right. Yeah. More the anteater look. Something
that came up in the book chapter that I published this morning on Substack. So in 1910, from a medical textbook, there's an image of spinal posture, and then if you compare the 1910 image of spinal posture versus now, the current posture is way worse. Do you guys think that the collapse in spinal posture and in full body posture over the past 100 years has anything to do with the collapse in jaw structure over the past 100 years, or do you think there's no connection? This is what I'm talking about. This image in 100 years ago, spines were a lot straighter. This is from 1911. And then this is from 1990. Look at how much more curvature there is in it. And at the same time, obviously, we've had the small jaws epidemic happen over the past 100 years. So do you guys think there's a connection there between the jaws and full body posture falling apart?
I think Ron might be throwing me a softball here, but I do think so, that where we're seeing a collapse in people's form, it would be a great coincidence. It would be an amazing, amazing coincidence that it's happening simultaneously. And so you have a lot of different fields. Like a lot of us got into this from the orthodontic and like the dentistry field, where they noticed the jaws are really small. And then the people that were looking at the spine, they're like, the jaws collapsed. And the people that are looking at mental health, well, that's a little bit separate, but they thought that collapsed too. So actually closer to what the original form is would be something like what the Alexander technique and those mentioned, which is that your entire form needs to be supporting your facial structure and development. Like Ethan, you were talking about using the stone, the gauche jaw, right? And it's like, how did that get you some improvement in the TMJ function? Because like that TMJ is going to be held in place, right, by the tissue in your bone, like the tissue from your neck and everything like that. So, I mean, when it works, and you got like so many anecdotal evidences like yours that there seems to be some, these guys are looking D's. This is how people should be looking.
Yeah.
Right.
Look
at this.
Definitely.
Look at this dude, huh?
Yeah. And I think, I think that even in farming communities, there is more forward head posture when you're squatting and leaning forward on the ground. But I think even in those communities, you don't see the same, recession in the jaws. you know, and maybe it's more to do with the food, the actual softness of the grains that they end up eating that then softens their jaw.
Yeah,
But I think also we're sleeping on more and more even surfaces over time. Like our, you know, beds 100 years ago overall were not as comfortable. So maybe you had to like shift more in your sleep. Yeah, and you also, people were working outside a lot more. Obviously, they're not sitting. I agree with you. Yeah.
Yeah. I would say with Alexander technique. So what we think of as proper posture, because that's been one of the main things that we look at, right? That okay, so how come the people that you look at, they got really good posture? Why isn't their face always well developed? Or you got people that their face is well developed, but you look at their posture and it looks like they're, you know, hunched over or something. And so if you look at something like the Alexander technique, they have an entirely different idea for what the posture should be like, and it is forward head posture. They say that is actually healthy because with the forward head posture, your nuchal ligament is supporting your head being upright rather than your musculature. So when your head goes forward, the nuchal ligament pulls it back, and that's what they propose is proper.
Isn't that a muscle? Not a. I mean, I'm sure there's ligaments too, but isn't there an actual muscle that is responsible for this?
Suboccipital muscles, those will pull that back.
Right.
SCM will pull it back, but the ligament, like you got one from the back of your head down to the top of your spine. So that's like actual ligament.
Right, but if you're actively holding it, your ligament's not going to be holding the weight. Your muscle's going to be holding the weight.
The ligament
like if you're no, not necessarily. Like if the ligament is in line with the line of force that your neck is holding the skull up with, then the muscles in your neck, including the suboccipital and then the whatever. The only word I know is backstrap from butchering deer, but the muscles that run down the spine, like what? So what you're saying that, like, I just don't think that if those muscles are active and you're holding your head up in a forward head posture, then there shouldn't be pressure on the ligament. Because like think about it, if like the finger, correct? There's a ligament connecting this bone and this bone, but there's also a muscle, right? So if I'm moving this muscle through its range of motion, most of the tension is going to be on the tendon. Maybe there's a little on the ligament as well, but I think if you're actively holding it, I feel like it'd be a little more musculature. But
I would say the ligaments should be passive, right? The ligaments don't have any force in themselves. So like if you see the side view of that nuchal ligament, if it's fully stretched out, it should naturally just be holding the back of the head or holding the head in position. Like if it's fully stretched out.
So if your head's slightly like this, it'll be held by it, is what you're saying?
Not like a downward posture, but rather forward. So like the back of your spine.
Can you show the picture of the green one? That's a good image.
This one?
No, the one from the green. It was green from the side. Oh, down there, next to the bottom left. Yeah, that one. Yep.
Yeah.
Okay, that's a good photo.
Yeah.
So what? So continue.
Karen, can you load up an image of what you consider to be good posture?
For the Alexander technique, even if we Google it, we're not going to find it, because this is something I'm exploring recently, right? Mm-hmm. So I do think all of the ligaments and the connective tissue in the body, that's what really forms the shape of the skull. But this is kind of recent research, so I will get a sort of information.
Well, I would say that I agree. I think, but there's also a reverse effect where the posture that you take in an active position with the muscles during the day is going to inform how that ligament forms. Right? Is that also your point?
Yeah, if we could just see the ligament again, I just want to see if does it make sense the way I'm saying that? Like, if the bottom of the ligament's attached to your upper back, so the top of your thoracic spine, and then you have that natural C curve of your spine, right? Mm-hmm. And your head's just slightly backwards. So if all of that green stuff is stretched out and taut like a connective tissue should be, then it's automatically going to be holding your head from falling further forward. So your head's going to be forward, but rather than falling all the way forward, it's going to be that nuchal ligament that's holding it from going further forward, because that ligament's fully stretched out. It's not going to stretch any further.
So just so that we have a little context, like, what's your opinion on this woman's posture?
It is, well, she's carrying a kid, first off. And like all those people are doing gestures. That should go cow. Like I've seen that thing. So I think she's correct about the low back. The lower back is straight in these people. When you
what about that guy right here?
Yeah, I think they're say the guy third on the right. He'd be closer. Yeah.
Closer to what? Alexander
closer to-
technique.
Yeah, closer to ideal. Like the guy on the left's a little bit posturing, right? He's got his chest open and things like that. It's not necessarily his resting. And then the guy in third, he's like more resting. He's relaxed. And so the low back posture, like for those tribal people, like in the Gokal method, their low back is straight, which is exactly what it should be. And then it only bends according to Alexander technique. And the theory is essentially this, that you want to keep your fascia spread out because it only works if it's tensile, right? If you have a rubber band that's like all loose, your muscle can't pull on it. Your bones can't pull on it. So the fascia only works if it's stretched. So the lower back fascia, the nuchal ligament fascia, the upper back fascia, that's only going to work if it's stretched out. And the posture that stretches it out is a wide back where the head comes slightly forward.
So you have no image or anything that would allow us to have a visual of what you mean and what you're referring to?
I think I get what you're saying. It makes sense.
Let me see if I can find one.
Bailey, what do you think about posture?
I think it's extremely important if you're going through MSE.
How do you mean by that?
I think that maybe potentially some of the muscles can influence back here. And I remember you had said previously that you struggled a lot with the base of your neck and a lot of those problems.
Yeah.
I think that in my case, if you don't get into a bite sooner than later after expansion, that no force or lack of a bite can kind of start to relapse, and some of the muscles from being in forward head posture after those sutures are weaker can affect or potentially change the base of the neck. At least for me, it feels that way.
So, yeah, say more about that, about how important it is to reestablish a bite after doing expansion.
Yeah, a lot of my neck muscles have become very weak from not being in a bite.
Interesting.
Like my neck has gotten significantly smaller. But
And you just did MSE, right? You didn't do anything else? Like what else?
Yeah, I just did
update me
MSE.
on your. Okay.
So
Yeah.
yeah, December I started expansion. I was done turning around maybe February of 2023, and then I continued to do expansion around October of late 2023 until about November, and then from November until now, I've just been letting the sutures close and going to be going into Invisalign. But in this long period of not being in a bite, it has significantly changed. I would say like my neck muscles and maybe just not stimulating any sort of up here as kind of maybe from sleeping on my sides. I'm not sure.
And you didn't have any Invisalign in during this?
No, I was in braces. I was turning during.
Oh, you were in braces.
During braces, which I personally would advise against.
Interesting.
But
yeah, interesting.
I'm sorry. What would you advise against?
Turning while in fixed braces.
Well, right, because wouldn't the fixed braces just resist the expansion?
I don't think so. I think it would. Oh, well, I guess it would resist in a sense, but
if it crosses the middle, then I think But if you had only braces on these teeth, then it wouldn't. But yeah, if you got it here,
I cut the wire. I cut the wire because I was
That's
expanding,
awesome.
and I was like, bro, something's off. So I cut the wire, and I told Nawaz, I was like, Nawaz, I'm so sorry, I cut the wire. And he was like, bro, just like tell me next time. But I was going crazy. I even called Ron up. I was like, man, I'm freaking out, man. I cut the wire.
Oh my God.
But yeah, so turning in braces, I highly advise against. I think it amplifies. I've been very vocal about this movement right here when you're expanding. And I think it really amplifies that effect can bring these front teeth back, recess your bite. So that I feel like that happened to me, even though it's just maybe millimeters, but yeah.
It's a game of millimeters.
Your upper is much wider than lower at this point. Does it feel like when you bite, like what teeth are touching?
Well, I have to pick a side. And I do think that if you lose a side or over time, if you expand with the arms and you take the arms off, if you don't get into braces or Invisalign after that, the teeth can collapse significantly more on one side or the other. And
wow, that's interesting.
Like when I bite, these teeth are way out compared to these. I find that when I wake up, I'm kind of biting down on this side. So now I'm kind of starting to notice a bit of asymmetry. But
Yeah.
hopefully once I get
Yeah,
into
I think for people like you, because you had a pretty even maxilla before, it was pretty symmetrical in the center. I feel like for people like you, it's MSDO and MSE is a good combination if you have a good angle on your jaw. But I think for you, it might be a little risky on the lower jaw, just aesthetically.
Yeah, I'm not too interested in MSDO as much as I am.
Are you thinking the
SFOT.
sliding? Oh, you're just doing SFOT?
Potentially, yes. It depends on how the treatment goes with getting into a bite and how much I can kind of influence the rest of the face through the bite. But we'll see. I'm even considering doing another MSE or potentially FME. We'll see.
Are you not
what would that be for?
Just to weaken the sutures up again.
So that you can do what? Pull with the face mask?
Bite.
So that you can.
How is that going to get your lower jaw in line with your upper jaw?
I think the teeth have, when you bite, transfer force into other parts of the face and potentially the sutures, and can help develop the face sagittally, just on a suture level, just shift it around. Potentially, this is just, I haven't really thought it through, but right now I'm considering doing.
But isn't that your upper jaw?
Yes, but I'm considering doing headgear with the new MSE or FME for the upper jaw, but I'm not too worried about the lower jaw because we can just tip it out, tip these in. It's more or less the position sagittally that I'm worried about.
You want to pull your maxilla forward?
Correct. Yes.
But you're saying you want to do another MSE, and how do you expect the lower jaw to ever match the top?
Well, I'm not going to max it out or anything. I'm just going to get a split, maybe do a 10, 15 turns and just pull with the headgear and try to bite as much as possible. Try to get some more prominence here, more prominence in here.
No, I get all that. I'm just worried about the lower jaw being too, like, if it's too small to even tip the teeth. But I don't know how much of a gap you've got. But I don't know. I'm not saying you do that with MSDO, but
once we bring these top teeth forward, we're gonna see if I need MSDO. I really don't think so. I didn't go too crazy with the expansion, but I think I did once these front teeth came back because I did turn in braces. These bottom teeth just like went way back. It's like the arch of them now are just like way up here. I think I got a bit of root resorption, a bit of bone loss here, so hopefully we can kind of pull it into, but like in Ron's recent video, he said it's not really, you can't really do that. You can't just pull teeth into nothing. You're most likely going to need SFOT. So most likely my treatment will result in some SFOT, and that's maybe it. Well, I'm still on the fence about expansion again.
Karen, what do you think about all this skeletal expansion stuff?
It seems to be the best that we have for especially cases that are doing like sleep apnea issues, right? Mm-hmm. So when the house is on fire, like you just got to put out the fire. So I'm really glad that people are doing the research on it, and like you guys are giving everyone the knowledge they need, so we're not flying in the dark. Like you recently did the post about. I just wanted to do the comment on that history repeats itself post that you made. Where I mean, I love that guy's enthusiasm. Like I love the hope that he had and everything. Like he thinks. Like this is it, and man, I remember that feeling where it seemed like certain things were the holy grail.
Right.
And yeah, for the skeletal expansion, if the MSEs and those things were causing a lot of changes up here, like in the head, I would be like, okay, this is probably what should be happening, like physiologically, biologically, like that makes sense. Because if you put the force here and the whole skull unwinds and starts changing, that seems more sound. But if it's a localized thing that you're putting force in the jaw and only really first off only the teeth are moving, then that doesn't seem like the force the body wants. Then even if you crack this open and then you get a little bit of movement here, but it's not showing up further up, I'm more of a naturalist, right? I'm still happy that we're doing these conversations so that like people can get the help they need, but I'm more inclined to try to find that why did this happen in the first place? Like why are we collapsing? Right? Because if we don't know the cause, we can't find the cure. And so like my proposal is that the cause is the whole body, like everything's tensegrity, so it has to unwind all at once. I did send in the chat, the private chat, there's a video I'll send it. Do you see that, Ron?
The private chat. I didn't even know there was a private chat. Oh, look at there it is, the private chat.
Have you had jaw surgery or something?
Who?
What's up?
Whole body?
No, bro. No.
Dude, you're freaking wide, brother. You have a forward grown face, man.
Oh, from the side, maybe not as much, but thank you. Yeah.
Get to know your torso.
Yeah, that's it, bro. So 4 minutes, 16 seconds in, you're going to see the posture that I'm proposing. This guy's proposing too. This guy's, I forget his name, but I recommend people check out his channel if you're interested in this sort of stuff.
4 minutes what?
4 minutes, 16 seconds in. Yeah. The correct posture is the right one.
Correct posture is the right one?
That's the one on the right, yeah. That is
So almost
the posture.
almost like the start of like a Jefferson curl.
Yeah.
Yeah. Like
Why? Why is that the right posture?
Because so you're saying because that is resting on the ligaments instead, right? Or something like
Exactly. No muscular effort. Like if you're really doing that posture correctly. And this gentleman is doing a good job explaining it, and he's still in the process of learning. So his channel name is Delsarte Alexander Masuero. So this is the line of thinking, right? So Alexander technique, then Masuero built up on it, and then this guy's building up on it further. But that would be the posture in which there's no anterior pelvic tilt, so there's the tilting. Your rib cage isn't compressed or back and things like that, and your weight. Well, that we're getting into theory if I talk about this too much, but exactly as you said, Ethan, that this would be the posture where your muscles are not doing anything. It's entirely your fascia, your connective tissue, that's holding your posture. That's the proposal.
But isn't he in like an anterior pelvic tilt? Why can't he just strengthen the glutes and kind of keep his neck back up like that? I don't see how that almost forward head posture on the right would be beneficial with the shoulders forward and everything.
Yeah, this would be saying that the guy on the left is definitely in an anterior pelvic tilt, right? But the guy on the right, he's actually neutral. His back is straight, and his rib cage is lifted up. And the way that he's proposing that they look at this is, you see the guy's sternum? He's got the top and the bottom of the sternum, right?
Mm-hmm.
The guy on the left is usually maybe considered good upper body posture, but his sternum is back at the top and then up at the front, like forward at the front. And this guy's saying you have to have a direct line, like the sternum has to be vertical, because when the sternum is vertical, you can see the rib cage. The rib cage can expand at the back. And the majority of your breathing and your lungs are actually in the back.
Mm-hmm.
And the majority of the fascia that keeps you upright is in the back.
It looks like the dude on the right's about to like deadlift or something.
Yeah, he does. And you can see his arms are rotated inwards, so his arms aren't bent. It's essentially a stretching out of the entire back. And I know this is like it's a stretch, right? Like, how would we believe this? But this seems to be what the Alexander technique is proposing. It's just most Alexander technique teachers are too cowardly to have their students actually take it all the way.
Take it all the way being
like to looking slouched like that, because people would look at something like that and be like, who's your posture teacher? Like, what did they do to you?
But I feel like I see old people who with poor posture, and it's an exaggerated version of the right.
You're not buying it, Bailey?
I mean, I want to know why it's superior.
Yeah.
I mean, aside from
better for what
video.
exactly? Like, is it better for strengthening the ligaments in a certain position to get better posture over time when you only do it an hour a day, or are you saying you should be in that position all day? Because I think being in that position all day is kind of ridiculous. Like, I don't think that actually, even if it's just for aesthetic reasons, like, people, you don't want to look like that. Like, I don't want to walk around like, hey, what's up? Like, that doesn't, like, even if that's good for me, I'm not gonna do that all day. I might do, like, I do Jefferson curls. I do, like, I do exercises where I'm getting into that position. I'm loading my ligaments. And I think that's really good. But I'm just, for a daily posture, is that what you're suggesting?
Yeah. So the studies show, like, when you see studies, they say there's no correlation between posture and pain. And this guy's proposing that the reason that the studies show that is because what is seeming to be correct posture, that has nothing to do with what correct posture is. And as you said, like, old people, they look like the ones on the right. And when you see somebody who gets really tired, you look like you're on the right.
Mm-hmm.
And so that's essentially you're tired. Your muscles aren't working, so you go back to essentially falling back,
Loading your ligaments.
loading your ligaments. Exactly.
Does anyone in nature actually adopt this posture? You know, evolutionarily
Well, I think that
or
is
naturally?
the more natural hominid posture,
Yeah.
right?
I don't know
Like
that.
the upright. Well, it is absolutely. If you look at chimpanzees, gorillas, like they all are much more functional and spend much more time in a rounded forward posture than we do. Like we spend our time like artificially putting ourselves in extension.
How come athletes who have to have their body in the most optimal position at all times never adopt this posture when performing?
Yeah.
That's completely untrue. It depends what sport you're in. Like that's just not true.
Football.
Like there's plenty of places where you could have your back rounded like that. Like if you're so football, I'm not specifically saying any type. Like I'm saying, I'm sure there are apps like for deadlifting, for example. The majority of people probably don't want to have that rounded posture, right? So that sport wouldn't be great. But if you're a swimmer or like I played baseball, there's absolutely places where like you athletically need to be able to round your spine in a way that you're not going to break your ligaments. Like you need to go through like tennis or like you're that's athletic. This is athletic, being able to move forward, backward, extend. I think that's the main problem. We're just sitting in the same position all day and everything's tightening. But instead of like, I'm reaching up here, I'm climbing stuff, and then I'm on the ground. Like that's just keeping
I
your
can't
body
say one thing. Like boxers, like they're not fighting like this.
Yeah, exactly.
So that's one thing.
Exactly.
Could you pull up a picture of like a hunter-gatherer, like of like a tribe or something, and see if we can get a picture of like their side posture, maybe if they're not.
Yeah, the boxing is a great example. Yeah.
Well, like what Ron was saying, like I agree. Like I don't see football players or anyone that's in an active movement really in that hunched over position.
Yeah, they do get injured like a ton though. Like pro athletes are just always injured.
A basketball player, they're hunched over. Dribbling, you're like this. Basketball players.
The people sitting down is a good one. The one immediately to the left over there. All right, yeah, where your mouse is. Or the black and more black. Well, this is fine too. I think you can see it. Yeah, that one where your mouse like was right over. Yeah. Like you see, like their head is forward of their body. And, like that'd be considered forward head posture.
Yeah, that's what I was talking about.
They're also squatting,
sort of.
Yeah.
Can you zoom in on some of those photos a bit more?
Interesting. So what is this? What is the posture, the Alexander? What is it again?
Alexander technique.
Alexander technique. And what is it? Just allowing your body to kind of fall into place?
Exactly. Like
so
when
if you spend all day kind of looking at your phone in a forward head posture, and then the other hours of the day you just allow your body to fall into that place, wouldn't you just further make that posture worse?
The forward head posture,
or slouched, like forward head posture. Like I don't understand how that's the Alexander or a form of it. Like I feel like an active correction of your posture to an extent is healthy.
Yeah, the head posture is like in relation to the torso, right? And so I think the proposal is that the people that have that forward head posture, and like we do say the phone and that sort of thing because that's like a good reasoning that we can have. Like why do
I think even like factory workers before phones,
Yeah. And the proposal is that it's not that their head's forward, it's that their torso is like angled. So their torso being angled backwards makes their head look forward.
Pull up more photos of people pulling arrows, because they're part of the back is arched sometimes.
Yeah,
like it's extended on one side and then sort of like arched around on the other.
Yeah, but like for any of these people, their posture is not like the head and the back of like the head and the back are not lined up. The head will always be forward to the back, like in that way, forward head posture. So not like terrible forward head posture, but proper forward head posture, where the nuchal ligament is what's supporting the head.
Yeah, I think if you have a good bite and you're, not like mouth breathing, I think that would make sense as like an active, the best active posture to practice.
Take a look at wrestling positions. Like
yeah.
like they're about to wrestle. So that's what people are saying.
And
What is that?
There it is. How about
Chad.
look at those dudes, huh?
his lower back too is straight. The lower back straight, the torso straight, and then
Lower back's even rounded, yeah. I do think it's good to strengthen through those rounded positions. I definitely agree with that. Like both passively and actively.
Yeah. Have you guys heard of hyperarch fascia training? What Coach Zhang is doing?
What is it?
Hyperarch fascia training, and he's the one who trains like the top UFC women's fighter from China. And
Is that Wayne? Wayne?
Yeah. And essentially the purpose of it is that your glutes or your back muscles, latissimus dorsi, trapezius, they don't actually attach to bone. They attach to fascia. Like the glutes attach 80% into fascia. So if the fascia is loose, like say, imagine you have a muscle that's trying to pull on a bone that's like spaghetti, like the muscle's not going to get any purchase. It won't be able to make leverage. So the fascia has to be in a lengthened state for it to be effective and useful for your posture or for your movements. And then furthest thing would be like, with my theory for whole body breathing, like we take people through the course. And so when people can feel the breathing in their head, we've been introducing this sort of posturing, and it increases the amount of feeling that they get in their head and the adjustments and pops and cracks.
Yeah. Well, I'll say one thing that I went through, I was saying to Ron, how when I opened up my MSDO, the lower jaw with the MSDO, it sort of holds the ligaments and all these muscles like really tight at the base of where my tongue is and where it sits. And it was so tight to the point where I couldn't extend my neck like this because of how tight those ligaments got. But if I didn't spend significant time doing exactly that posture, I jutted my jaw forward to like stretch it, and then I did that sort of stretch. And I think if I didn't do those, I would have some serious tightness issues in there because I could not even raise my neck, and I was kind of freaking out for a little. I'm like, is my posture going to be all fucked up? But yeah, those ligaments are powerful.
And that's like even Bruce Lee type strength, or like what the Qigong and those martial artists are always practicing, right? That it's all in the ligaments and the connective tissue. They're trying to build that up for strengthening.
Have you seen those guys? There's this, I forget. Have you seen those guys they do weighted sandbag training? So they'll have 100-pound sandbag on their chest, breathing for 4 hours straight.
Yeah.
To train their diaphragm and their chest and their all that that. I haven't tried that, but have you guys heard of that?
Yeah.
Really, that's incredible.
Yeah, that I found super interesting. I wonder what's that?
Their names are MoveMed, Flowability. I'm pretty sure those might be the guys you're talking about.
Okay. Yeah. And you guys remember Aiden's balloon stuff?
Yeah.
So Ron, you mentioned what is it called? Craniofacial release, the one that balloon in your nose. Is that
NCR?
Nasocranial.
Neurocranial restructuring.
Okay, so there is. I think that Aiden is definitely correct about the balloons. So I haven't been doing balloons, but I've been doing the pressure, just with closing my lips, and then I also because my logic is with the balloon. You're just sticking a balloon in there with a bunch of fragile stuff, and you don't really know what you're gonna hit. And it's in there for a second, and then you're just blowing it up, and it's so. But what I've been doing is plugging my nose so that all of the cavity is expanded with the same force that you would get with a balloon, but in the nose. So as I've been expanding during, I do it while I have face mask in. I'll do it randomly, but I'll literally push it, and it try it if you want, but like combined with when I was pulling, it just feels amazing for opening that up. And I think that internal pressure, it can support the like keeping this forward if you do get MSE.
Are you saying just plug your nose and blow, like just make pressure?
Pretty much, yeah. I don't know. I mean, you know, think whatever you want about all this shit that I do. I just like experimenting, and I don't know what's true, but I really feel like this has been important for loosening my sutures around my face. So they cracked, right? They cut this open, and then about for a month it's been hardening, and it's pretty hard now. It's like almost fully closed. But the other day I did this on the suture, and I opened it more again. And so, I can, you know, if that's happening there, then it can happen on a micro level when I already have a broken nose here, right? So this suture is weakened. So maybe that keeps it looser. I don't know. But I literally do it on the bone. People think it hurts a lot, but I think that combined with the blowing, I found a good relief from that, but who knows?
Have you had any issues with creating ear infections for yourself or anything like that by putting all that pressure back up into?
No, I stop when I feel it
sinuses?
in my. I stop when I feel it in my ears. I don't push it too far.
At one point, I was experimenting with inflating balloons with my nose, just because I started getting into balloon blowing, but then I was like, well, am I really just training mouth breathing right now? So I was like, okay, well, I don't want to do that. Can I get the same benefit of adding resistance, but to my nasal breathing? So then I started for like a day. I was experimenting with blowing balloons with my nose, but immediately started feeling weirdness in my ears. And then I was like, yeah, I definitely don't want an ear infection. And then I pulled the plug. But then I found this other thing called a Hawaiian nose flute, which is a flute that you play with your nose. And I did purchase one, and I was delivered from Hawaii. Actually, I have it right here. Let me go grab it.
Yeah, unfortunately, I'm late for a client call, so like, hopefully we can do this again sometime soon. Really good talking to you guys.
Yeah, that'd be cool. Thanks for coming on.
Great to meet you.
You too, man.
You too. Yeah, the nose flute. I've seen that. Go ahead.
I've never seen that. What are your thoughts about pulling healthy wisdom teeth for MMA or jaw surgery?
Ooh, I don't know.
Ron, what are your thoughts?
I probably would avoid it, but
what are your thoughts about pulling healthy wisdom teeth? Oh, that's it.
Hawaiian nose flute. Yeah, I guess you sort of put it right here, and then I mean, I suck at playing music, but I can't get it to do anything. Yeah, I'm not even gonna fuck with that right now, but but it is possible though to train nasal breathing with resistance using a wind instrument at your nose. So it's maybe something worth looking into for someone who's interested in doing some resistance training on their breathing. What were you saying, Bailey?
Pulling healthy wisdom teeth for jaw surgery.
Bro, I don't even know what to think.
Let's not get into it then.
Here's what I would say. Any of this stuff is the art of the possible. Like, you can't do anything unless a doctor consents to treating you. You're not going to treat yourself with jaw surgery. You need a surgeon to operate on you. You need an orthodontist to give you an expander. So if they won't treat you unless you get your wisdom teeth out, well, then I guess you're stuck, right?
Right.
Because there's really no decision to be made at that point. It's either you do the treatment and get the wisdom teeth out, or you don't do the treatment.
Do you know of any jaw surgeons that do jaw surgery without pulling wisdom teeth?
I mean, it's got to be on a case-by-case basis, right? Like, surely some people need to get them removed and some people don't, right?
Yeah, I think maybe if you had a really narrow mandible and you didn't have a lot of room to work with, and if you took one of the two teeth out, it would maybe make a room for a longer cut. Then I think in that scenario, it might make more sense.
So what is the issue with, why do jaw surgeons obsess over pulling wisdom teeth? Is it because the BSSO cuts require a little bit of extra space at the back?
I think it's partly that, but I think it's mainly because they almost always erupt after, and they have to get pulled anyway. I think that's the main reason.
I'm sorry, because you make the bone bigger, then now the teeth are going to erupt. But wouldn't that be a good thing?
So this is kind of where you make a decision. Like, if you're the kind of, this is like, it's a game of averages. And if you're a doctor, you don't just want to recommend to some random person who you don't know what their oral hygiene is like, to have like you're eating whatever the fuck from Safeway or whatever store that's full of garbage, and then you're not brushing your teeth the right way, and then you have a new adult tooth coming in like that. It's gonna get infected. That's not gonna be a healthy tooth.
Well,
but if you can bring it in and make it healthy,
it should still be like informed. That should still be informed to the patient of like, hey.
I agree. I'm just saying I agree. But from like a logical perspective, I think I can understand the argument either way. But I know several people where they erupted as adults, and they don't, even if like. You're assuming that they're going to erupt in a full way that makes them functional. But I think like if they're like partially sticking out of the bone and fucking with your bite, and you already went in there with MMA, like if you're doing MMA, you're destroying, like you're literally obviously cutting it in 3 pieces. And I think at that point, that wisdom tooth is less valuable than if you're really trying to keep this together. Like if I got my wisdom teeth out, like just because I wasn't really thinking at the time, and wasn't informed about any of this stuff. But if I was going through this again, I probably wouldn't get them removed before. So I would say, like, keep them in if you can, but understand that there's a benefit to getting them out in rare cases.
And then the only question that pops in my head then is long term. Like, I mean, I guess jaw surgery would be okay, but like, let's say once you get to your 60s, 70s, and you don't have the wisdom tooth, and that could have provided, extra support or scaffolding for the infrastructure of your jaw. Like, is it
right?
Really
but I mean, if you had MMA, you'd have metal plates doing that. Like,
yeah. I guess that. So Bailey, the question is, do wisdom teeth really act as placeholders for the bone? And if we get them out as adults, does the bone really resorb? And Mariana Evans tried making the argument to me that that's not actually the case, that if you get wisdom teeth out, that you don't actually lose the bone. I don't know if I buy that, because
I don't buy that. I think you do. Again, I'm not saying that you should do it. And I think I completely agree with how what was your explanation, that it's like a buttress or something, at the back of the mandible,
concrete footing.
Like, I agree that it is a very important thing in there, because it's actually more dense than the surrounding bone. Like the tooth is denser than the bone. Like that's why you can dissolve the bone by pushing on the teeth.
So then the other thought that I have is that liability is everything in modern medicine and dentistry, and we live in a very litigious society. And if the standard of care is to have wisdom teeth removed prior to jaw surgery, and then a surgeon doesn't do that and something bad happens, then they're liable. And so it might just be that it's automatic for them to recommend that they get pulled just to cover their own ass.
Right.
I don't know if that's true. I think that might be
That's
true,
a good point.
But I think it's definitely something I want to figure out this summer. I'm going to be interviewing a couple of surgeons this year, and that question is going to be right at the top of my list. And it might be a combination of all of the above, where it's like they kind of have to for legal purposes, and it's kind of messy if you don't, and it's a messy situation. But obviously, it throws patients for a big loop when surgeons tell them they got to get their wisdom teeth out, and they're like, "Whoa, that's not what I signed up for."
Yeah, but then the general population wouldn't even know or be, against that. That's what I think the problem is not even being aware of the potential downsides of getting your wisdom teeth removed, because everyone does it. It's just such a popular thing.
Any medical intervention, doctors don't really inform you about all of the pros and cons. I mean, with anything.
Yeah.
What doctor is giving? Like, there's very few doctors that are really giving you the full. And you have to ask questions if you really want to get the full scope of.
But what operations like that are permanently removing a part of your body as a part of the surgery? Like I think wisdom teeth are such a
foreskin.
Cutting
your foreskin off. That's probably the only one I can think of.
That doesn't potentially affect your airway. So or
obviously, yeah, but No,
But
there's no like analogous thing that you'd be removing. Yeah, that's a natural.
It affects you in
part
other
of your
ways,
body.
though, Bailey.
yeah.
Are you circumcision pilled yet? I mean, like people talk about it. I had someone on my
I've heard Joe
channel
Rogan
talk
speak
about it.
about it. I've heard Joe Rogan. Like,
I guess it can affect the your erogenous experience, right? Because you're taking it can seriously affect a man's experience with sexuality. Basically, obviously, you probably heard about that, but.
Mhm.
But I would say, though, the airways could be more catastrophic, though, having extractions and retractions. It's a competition of, suck versus really suck.
Yeah.
Yeah, and like I said, I think if you're doing the double jaw surgery, then
I mean, there's extractions, and then there's extractions before jaw surgery. Maybe extractions prior to jaw surgery are sometimes called for, or maybe always called for. I don't know. I got to figure it out. But then it's just like extraction and retraction in a young orthodontic patient to straighten teeth. Now that's really a tragedy.
Right.
Right.
I just think that's the biggest entry level for the general population who knows nothing of this to kind of like get into it. Is like, why do we have to pull wisdom teeth? I think that's the real catalyst here is wisdom teeth, and what will get a lot of people into, why do we mew? Looks equals health,
Right. You think wisdom teeth, Bailey, are like a major lever in this for this community?
100%. I think it is the number one thing that could get a really big spotlight on this community is wisdom teeth.
How do you propose, like, what message do you wish you could get out there to people, like to kids your age who are about to go get their wisdom teeth out because their parents insured, they're going to turn 26 and then they're not going to have insurance anymore, so they want to rush to get them out while they're still covered?
I think honestly, my priority is health, of course, but the majority of people probably care more about their looks. So really emphasizing the looks part of it would be ideal to kind of get people to be like, oh, what? Are you serious? Really? But underneath of that is it's mostly health. How would this affect oxygen levels? How would that affect, your DNA or the production or the quality of your sperm for your potential child in 15 to 20 years? That's the type of stuff I think about.
I think we need the data. We need some sort of conclusive study that really demonstrates that people that have wisdom teeth removed preemptively are suffering this change in their cephalometric. Their maxilla is clearly recessed as compared to people who don't, or narrower, or both, or they're higher risk of sleep apnea. Why don't we just take a sample of people? Let's take a sample, figure out if there's an association with wisdom tooth removal and sleep apnea.
Yeah, and I think with the right mentality, of course, because there's a plethora of studies that show there's no correlation. And I think it's to protect this orthodontics as a whole, the current standard, the current way that it operates. Because if wisdom teeth extractions or premolar extractions were to lead to a recessed jaw or potentially airway, that could be a really big problem financially for a lot of people's livelihood, or a lot of, orthodontics provides how many jobs for how many people. So I think it's like, whoa, wait a second. If this is providing money and affecting the economy, why on earth would we, stop this part of the process? Like, but at the end of the day, like, if it's the only way people would really wake up to it is if there's a proven way that it would affect your face, your looks, your jawline, whatever. Because
do you think it could be different
because it looks?
Do you think it could be different in your maxilla versus your mandible? Like taking them out in one versus the other, maybe because
upper. I feel like upper would be worse because it's right there next to all of this airway, but lower could be potentially worse as well. But
because I'm thinking with the upper where the wisdom teeth, I don't know. I have to think about it more.
Yeah, I think most likely upper, but
either way, either way, I think
people to shine light about this, it's 100% wisdom teeth, because right now mewing is more popular than ever. So if we can kind of hone down on why looks equals health, it's the perfect way to kind of take that next step into culturally why wisdom teeth removal is not good.
Is that true, Bailey? That mewing is hotter than ever right now? I didn't even realize. Where is it hot?
TikTok, YouTube, Instagram, everywhere. People are doing the emojis. where they're
Yeah,
like,
it's more.
like
It's
it's
definitely
like
more
yeah,
prominent.
it's a trend right now. It's like bye bye all those
Yeah.
like sounds.
It's like a
and
meme.
stuff.
It's like a meme among like teenagers. Yeah.
Looks maxing is really popular right now. Like they'll be like, oh, look at the cantle tilt of the, this or that, or the brow, hunter eyes, like blah blah blah. Like, I think Ron, you started this wave, my boy. I think you
Yeah.
started this wave.
Come
Seriously,
on, man.
You and Mike Mew, seriously, it's like more popular than ever. So
Damn.
this wouldn't have been a thing right now. Like we literally wrinkled the fabric of reality, and it's wild to see like the outcome of the past like 2 years of JawHacks, man.
Yeah, I
So-
mean, I'm Ron. I mean, I want to thank you so much for like pointing me in the right direction with these doctors. Like, I mean, Yousefian was. I guess you mentioned the other one in Seattle, but yeah, Yousefian's been great, and yeah, I would never have been able to find that otherwise. So thank
Good,
you.
man. I'm glad you've had a transformative experience. And yeah, Dr. Yousefian is obviously the man. And I don't think there's anyone else in maybe the world that you could have gone to get the result that you've gotten. I think you got a ways to go, man, but what an incredible thing you've gone through. You have a whole new skull.
Yeah,
Bailey, you
I
too,
agree
bro.
with you. Yeah, you
Thank
definitely
you.
look different, man.
Your cheekbones are looking real sharp, man. You look great.
Thank you,
Once
bro.
your teeth come back together, bro.
I'm excited, man. I'm really excited.
You don't even have that much of a gap like that. Like that looks fine.
They've
Nah,
like dispersed. It's like here.
Yeah, but
here,
for
here.
me, I never that
Your
that
teeth
looks
look
fine,
fine,
to me.
Bailey. Your
Yeah,
teeth
that
look
looks fine.
Thank you. Yeah,
Because,
I'm-
dude, I mean, come on, dude. Look at that fucking gap. That's not the same shit.
yo,
That is not the same shit. Bailey, did
Dog.
you see the whole? I don't know if you were there before, but the whole like it looks like a squid, dude. Look at that
Yo.
shit.
It looks like
Yeah,
it,
man.
a giant
That's
spider.
awesome. I think that's
Yeah.
a bigger gap than oh my
Scolo?
gosh, yes.
He said
Come on, bro.
he said it was the
You
big.
bringing Scolo into this?
That's
No.
a bigger gap than him.
I don't know about Scolo, but Yousefian did say I was what?
Oh man, I was just making a joke. People were like, band for band. Just go gap for gap. That's hilarious.
Yousefian did say that it was basically the biggest gap that
He's done.
and there's one other patient that got a similar gap.
There's one that works for New Orleans. His name's Rob. Shout out Rob. He did like 2 MSUs, I think. He like broke. He like popped the suture like twice. He's crazy. Or,
I
no, he
would-
did, like,
I mean,
3
I
or 4,
might-
think.
I might consider another one, but I think I don't know if you were here earlier, but the face mask for me has been like 70% of the breathing benefits. So I might just
Dude.
I'm at least doing it till September.
Uh-huh. What kind of face mask are you using?
Just the regular one I've been on.
Like forehead and chin?
This guy, but I have it tied to here, so I pull it off my chin all day. Because I'm using a lot of bands and a lot of force, so there's a significant chin cupping effect on my mandible, and I really don't want that. And so I only do a small weight at night, and that way it doesn't hurt my TMJ. But that's it. And then I am going in next week. He's going to try to design me one where it pulls a little differently. But I also bought I forget, someone in the Discord designed their own thing based on this, where basically they took this metal wiring sort of and extended this down to the chest like this.
So it's like a bow.
Yeah, like a custom bow. And like this material, I need to buy it a thicker version, a stronger version, but like this sort of material, it's like steel galvanized cable wire or whatever. And so that's the type of thing I'm going to use, but I have to get it thicker because of how much pulling force I'm using.
Do you think it's well, nah, bro, your frontal looks pretty solid. I was going to say the only concern I have with it being on your forehead is it potentially, affecting that, but like it looks solid. Can you turn to the side?
Mm-hmm.
You look like Luka Doncic.
Yeah, you do. Boy's
that?
going to the finals. He's
You don't
who's
know
that?
who Luka is, bro?
I'm not a big sports person, but I don't, especially names. How do you
He's the
spell
best basketball player in the world, bro.
it? Luke. What? Is he not actually, or are you just saying that?
No, he is.
Dead ass the best basketball
Wait, well, how
player
do you
in the
spell
world.
his last name?
And he's like a chubby white dude from Europe.
DONCIC.
Oh, thanks for the compliment, Ron. How do you spell his name though?
Luka or Lucadoncic.
He's going to the finals, man.
Okay.
Celtics, right? I should know. I'm in
Mavs.
Boston.
Celtics
Wait,
are going too, right?
Yeah, the Celtics versus
Mavs.
Mavs.
That's gonna
That'll
be
be
crazy.
good.
Kyrie. I'm excited to see that.
Oh, my
I'm not a huge
favorite.
basketball fan, but that's gonna be fire.
Does Kyrie still think the Earth is flat?
Probably.
I'm not even judging him. I'm open-minded.
Hey, I just like him speaking out. Whatever he's saying, I just enjoy the fact that he has the balls to speak out about whatever it is he believes.
Right?
That's fire.
Right? I get on board with that. This is Luka right here.
That's you, Ethan. That's you.
Nah, bro.
That's you.
That's you right
Not
there,
you,
right
bro.
there.
That's you. No, that's you.
Fuck you.
Not for real.
Fuck you.
Nah, man. Bro, y'all look similar.
Nah.
Bro,
I don't see it.
I don't
No,
think you
who's the other?
I don't think
no, but
I don't
who
think
is
you
the other one?
understand, bro. Watch this guy in action, bro. I don't
Who
think
was
you
the other guy
understand.
that you said I looked like, Ron? There was someone else that I think is more accurate.
Ethan Hawke?
Oh, Sean Strickland when I was bald. That's what you said.
Yeah.
That I can
Hey,
see.
he's
I can see
fighting
that.
tomorrow. He's fighting
I
tomorrow.
can see more of that. Yeah. He's got the Roman nose though. I have a guy like a German.
He beat up Sneeko good. Did you guys see that?
Oh my god, yeah.
That was kind of. I didn't really respect that, but
By Sean or by Sneeko?
I just
Sean.
don't really watch those that type of stuff that
I
much
don't think you should be beating
anymore.
up
But
on people who don't know how to fight. That's kind of like a bully.
Yeah, but he did teach him a lesson though, right? Like
Yeah, he was talking hella
actions
shit.
have consequences.
Yep.
I mean,
respect that.
Sneeko.
I
No, but
respect that.
Sneeko puts himself in that situation purposefully, like to challenge himself. I think he's not like just some random guy. Like, and Sean Strickland's beating on this average guy. Like
Yeah.
Sneeko's
was
putting
talking
himself
shit.
out there. Yeah. So
From when I first saw the clip, my first reaction was like, bro, like, come on. But still.
Sneeko's got a decent little skull, right?
Yeah, he's
got
actually-
good features.
Yeah,
What do you guys
No,
think
he
of
was a
Sneeko's
model.
head?
What do you mean? He was a male model.
he
Of course,
was.
he's got.
Oh, really? I didn't know that.
Yeah, he's got great facial structure. Yeah.
He's got a very prominent forward face.
He kind of has almost like that K-pop
He's
look,
younger there. Yeah,
where
he
he's
does.
kind of like
Well, he
boyish,
got-
but also a nice skull.
I think he's half Asian, half black, right?
I think so.
Oh, really?
That's
I
why.
don't know exactly what he is, but I know. I
I
remember
think
like
he's
recently
half
he looks
Asian.
pretty solid.
What's this bullshit? What is he faking? Like he's some sort of monk?
I think
Kanye now.
he's doing it for clout. I think.
Oh, is he doing
Yeah.
that shit now?
Yeah, he's
Oh.
a Muslim, I think. Which
Oh,
like,
that's
Well, he's been
Muslim
doing
garb?
that for a while.
but I think
He's been a Muslim for like a year or two now. When Andrew Tate became one, that was
Really?
He was like exactly right when Andrew Tate did. He was like, I actually really considered Islam now. Like, no.
I thought that was Buddhist for a second.
he looks like one.
Damn.
Snap. All right. Good talking to you guys. Thank you for having me on.
Me too.
Ron, I miss you. Ethan, I miss you guys. Last time.
Bailey, let's talk soon. Let's catch up. Give me a call sometime. Ethan, thank you for coming on. I appreciate you both coming on and, showing your expanders, putting yourselves out there and letting people know what's really involved. Obviously, it's not always like a super smooth, seamless process. It's a bumpy road. Life is complicated. Expansion is complicated. Adult orthodontics is complicated. And it takes balls to put yourself out there and show people your mid-process, mid-treatment face. So thank you for, sharing and maybe sacrificing yourself a little bit so that others can learn and have a slightly easier path forward themselves.
Thank you for making this possible.
All right,
thanks,
bro.
Ron.
You got it. All right, Ethan, thank you. And I'll talk to you boys soon.
All right. Have a good day.
All right. Peace.